2020. And Madam Clerk, over to you with regards to the call to order.
Good morning. I am going to briefly review the protocols for electronic participation in this regular council meeting. We continue to comply with provincial orders and public health orders and recommendations to support social distancing, as well as prohibiting public gatherings of more than 5 people. This meeting is being streamed live from the Region of Peel website, and we encourage the public to stay home in accordance with provincial and public health recommendations and listen to the proceedings from there. The people present in council chambers are Chair Yanika, myself, and clerks and IT staff sufficient to facilitate the technology and procedures for this meeting. We are conducting this meeting using Webex. If you are dialing in, please note that you will be required to identify yourself so we can update the system with your name. For an optimum Webex experience, we ask you to please take the following measures to avoid feedback and confusion with members speaking over one another. Please keep your microphones muted unless you have the floor to speak. Please use a headset and avoid using hands-free devices or speakers. Please speak loudly and clearly when you have the floor. Please ensure that any surrounding environmental noise, such as televisions, radio, and pets, is eliminated. The recommended Webex meeting display view is active speaker video view, or speaker and thumbnail video view, so that you will have a full view of the presentation slides and other meeting materials. During a presentation, we recommend that you close your participation list so that you have a full view of the presentation slides. If you are experiencing a poor Wi-Fi connection, please disable your video. If you drop off the meeting, please rejoin, and if you have difficulties, please contact your local IT department first for assistance, following the same process as you do for local council meetings. As required, your local IT department will reach out to regional IT staff for further assistance. The video function for Webex has been activated, so you may choose to turn on your video. You can choose to leave it on throughout the meeting, or you can turn on your video only when you are speaking. If you don't want to activate the video feed, you are not required to. We will still hear you, just not see you. Please be advised that we have made the necessary adaptations so that the videos of the participants will be included in the live stream on the Region's website. If your camera is on, those watching the live stream will see you. During staff presentations, the slides will be visible on your screens. If you have difficulty viewing the slides, they were all provided to you in the revised agenda that was distributed on Tuesday. If you wish to speak, please click on the round participant icon at the bottom of your screen to enable your participant list. To indicate your request to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Your hand icon will turn blue when engaged. Members who connect to the meeting via the dial-in option can send an email to council@peelregion.ca and you will be added to the speakers list. When called upon, please unmute your microphone and proceed. When you have concluded your comment or question, please mute your microphone and lower your hand by pressing the then blue hand to the right of your name in the participant list. If you have any motions or amendments to introduce regarding business on today's agenda, please email your motion to council@peelregion.ca, identifying yourself as the mover and also identifying the seconder for your motion if you have one. Each motion will be read in its entirety prior to calling a vote. Voting will be conducted verbally. For any procedural votes that do not require a recorded vote, I will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. Once called upon, please unmute your microphone and indicate your yes or no vote. I will confirm the vote of each member. This process will take some time, so please have patience. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you have left the meeting, for any votes thereafter, you will be marked absent. If you don't advise that you are leaving the meeting and you don't respond when called upon to vote, you will be considered to be abstaining, and a vote will be recorded in the negative as a nay vote. If the meeting should move into closed session, those members who are participating remotely must ensure that no other person is in the location from which you are taking part in the meeting, or make appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place. If this is not possible, the member must withdraw from the meeting until it is moved back into public session. Prior to moving into a closed session, members shall declare that they adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct. Members who leave the meeting during the in-camera session and attempt to connect back via the dial-in option will be required to send an email to council@peelregion.ca indicating their request to rejoin the meeting. If you have questions as we proceed through the meeting, please send them to council@peelregion.ca together with a request to speak. We shall now commence the meeting with roll call. Mayor Brown.
Hello?
Mayor Brown present, thank you. Councillor Carlson.
Here.
Thank you. Mayor Crombie.
I'm here, thank you.
Thank you. Councillor Demurla.
Present.
Thank you. Councillor Dasco.
Here.
Thank you. Councillor Dillon.
Morning, here.
Thank you. Councillor Downey. I can see you. Okay, you're muted, but I can see you, so thank you. Councillor Fonseca.
Yes, here.
Councillor Fonseca present. Councillor Fortini.
Yes, good morning.
Thank you. Councillor Groves.
Yes, present.
Thank you. Councillor Innes.
Present.
Thank you. Councillor Kovac.
I'm here, thank you.
Thank you. Councillor Mahoney.
Present, thank you.
Thank you. Councillor McFadden.
Good morning, present.
Thank you. Councillor Medeiros.
Here.
Thank you. Councillor Paleshi.
Present, good morning.
Good morning. Councillor Parrish. We did get notification Councillor Parrish may be late, so we'll note absent at this point. Councillor Raz.
Present.
Thank you. Councillor Sado.
Here.
Thank you. Councillor Santos.
Good morning.
Good morning. Councillor Sinclair.
Present.
Thank you. Councillor Starr.
Present.
Thank you. Mayor Thompson.
Present?
Thank you. Councillor Vicente.
Present.
Thank you very much. Over to you, Chair.
Thank you very much. We will now turn to our Indigenous land acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the Region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we wish to acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is also home to the Métis, and most recently, the territories of the Mississauga of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. And if I may, interesting piece of news. I think Councillor Carlson will be quite intrigued, as this is our resident historian. The clerk advised me this morning, and I want to be very transparent and open, that we may have learned from some of our Huron friends that in fact the term Huron may be pejorative and have a negative connotation. And I know George, like me, studied one of the founding Indigenous folks that looked after this land long before we came along, and always revered Huron Park in my ward that was a centennial project, Huron-Ontario, Lake Huron, and yet it was just brought to our attention that perhaps it is not an appropriate term. So I wanted to acknowledge that. We're certainly going to look into that and make it right, but I just thought my colleagues would be intrigued by that there may be a concern, and on all our behalfs, I'm saying if there is a concern, we want to deal with it. Apologies if we've been doing anything inappropriate for the decades going back to when I first, and George would have first studied it in school, as I say, one of the revered Indigenous communities that looked after this land for centuries before we came along. So more to follow on that, and I did want to acknowledge that point. Thank you. Are there any declarations of conflict of interest? I see no hands and no acknowledgement. Approval of the minutes from the May 28, 2020 Regional Council meeting. Madam Clerk, do we have a mover? I see Councillor Raz and I see Mayor Thompson seconding. Madam Clerk, a show of hands good enough for you. All those in favor? Do I hear anyone opposed? Seeing none, that is carried. Approval of the agenda. Once again, that is moved by Madam Clerk, over to you.
We have a few things to add.
And that's correct. There are a few additions to the agenda. Madam Clerk, what is in addition to our agenda?
That the agenda for the June 11th, 2020 Regional Council meeting include a letter from Malone Given Parsons Limited on behalf of Brook Valley Project Management, Inc. and Laurier Homes, Yorkwood Homes in Mayfield West, providing comments on the Mayfield West Phase 2, Stage 2, Settlement Area Boundary Expansion, ROPA 34, proposed council resolution to be dealt with under Planning and Growth Management Communications, item 18.2. And further, that the agenda for the June 11th, 2020 Regional Council meeting include a letter from Aird and Bearless, LLP, on behalf of the Mayfield West Phase 2 Landowners Group, providing comments from the Mayfield West Phase 2 Landowners Group regarding the motion on the Town of Caledon request for a minister's zoning order for Mayfield West Phase 2 Stage 2 lands, listed as item 22.1, to be dealt with under Planning and Growth Management Communications, item 18.3. And I see Councillor Downey would like to speak. And I think that there's an item she would like added to the agenda as well.
So, Madam Clerk, that concludes your list with regards to the agenda speakers. Councillor Downey.
Thank you, to you, Chair. I do have a motion prepared regarding anti-Black racism that I would like to have added to the agenda today. It is with clerk, I believe.
Very good, Madam Clerk, and you're aware of that?
Yes, and so that and further that the agenda for the June 11th, 2020 Regional Council meeting include a motion regarding anti-Black racism to be dealt with under motions, notice of motions, item 22.3. And further that the agenda for the June 11th, 2020 Regional Council meeting be approved as amended.
Madam Clerk, again, a show of hands.
No, any objections?
Are there any objections? I know it was first moved by Councillor McFadden and then I saw Councillor Raz. Are there any objections? If not, that is approved. Thank you. That brings us to our consent agenda. First items that we have are deputations, the COVID reports, bringing us down to items 9.1, an item of communication, 9.1 FCM funding. Do I have consent? On consent, item 11.1, automated speed enforcement. On consent? I have consent. Communication items 12.1. On consent, 12.2, a letter from the Minister of Transportation. On consent, items related to health, 13.1, responding to the mental health and addictions needs in Peel, which I think will also be spoken to during one of our delegations. But do I have the item itself on consent? Very good. That is to be held, I think, Councillor Sinclair, and again, it'll be dealt with when we deal with the delegation itself. Very good. So 13.1 to be held. 13.2, Senior Services Annual Report. On consent, items related to human services. 15.1, a strategy to address human sex trafficking. That is asked to be held by Councillor Downey. Item 18.1, letter from Jennifer Jarosek, Planner, Policy and Advertising from the Build Committee. I say Build Committee, the Build Association. Is that on consent? 18.2 and 3 are letters regarding Mayfield. On consent? Oh, no, that's asked to be held. Oh, so, yes, I acknowledge Mayor Thompson, who's asked that those two be held, items 18.2 and 18.3. Brings us down to item 20.1, correspondence from Rob Serp, Executive Director of the Peel Regional Police Services Board. On consent, other business.
Sorry, Mr. Chair.
Sorry.
It's Karen.
Yes.
For item 12.1, the school bus
cameras.
camera working group, there was a recommendation. Do we need to formally vote because it needs to go to Public Works? So it shouldn't be on consent?
Very good, Madam Clerk.
No, consent would be that it is referred, consent means that the motion as presented is carried, so it would be referred to council, or to,
Excellent.
sorry, refer to Public Works on
anyways.
consent.
Very good.
Thank you. I know
Okay.
that there's a
Hold it
motion,
anyways.
but, okay.
Yeah, we can
Okay.
hold it anyways, Councillor Downey, thank you.
Okay, so we'll double back then, and 12.1 is asked now to be held on consent. Coming back, did we deal with 20.1, Madam Clerk, the rubs? We dealt with it. So then I have the notices of motion that I guess we'll deal with at that time, Madam Clerk. Then we're on to the bylaws. So with that, also, yes, because there's just one in-camera item. Item 24.1, proposed property acquisition, Mayfield Road widening, west of Chinguacousy Road to here, Ontario Street. Would that be, as the only item in camera, would that be on consent? Very good. Okay, with that, Madam Clerk, the vote to you for the consent agenda.
Thank you. Mayor Brown? Mayor Brown?
I said yes.
Thank you. Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes?
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor?
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in, Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
In favor.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish is absent. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sado?
Yes.
Councillor Sado in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries. Thank you.
Thank you, very good. Moving on, Madam Clerk, we're on to delegations, item 7.1, David Smith. And I do have an introductory comment for Mr. Smith. I would like to welcome our first two delegates speaking today on item 13.1, responding to the mental health and addictions needs in Peel. A warm virtual welcome to our representatives from the Community Mental Health and Addiction Service sector. 7.1 would be David Smith, CEO, Canadian Mental Health Association, Peel Dufferin, and then we will come to 7.2, Carrie Harden, Chief Officer, Systems Integration. She will also assume the role of CEO, Peel Children's Centre on October 10, 2020. So with that, David Smith, you're up. Welcome.
Thank you, Councillor, and thank you to the Council for hearing us today. Now, I'm unsure of the process. Am I able to see the slides at the same time, or is that? Yeah, okay. So just, if we can go to the next slide, please. I just wanted to talk to you a little bit about our organization and who we are. First, beginning with the needs for mental health, adult mental health in the region of Peel. When you look at the statistics across the country and apply them to Peel, there should be about 276,000 people in the region of Peel that will experience a mental health problem or illness in a given year. CMHA is the largest provider of community mental health services. Peel Dufferin is the largest provider of community mental health services in the region of Peel and in Dufferin County. And we see about just under 22,000 clients a year. So I both want to point out that that with a limited budget and resources, we're able to provide a large number of clients with services and visits. But I also want to point out that that's less than 1/10 of what the estimated demand is for the region of Peel. There are other providers as well that provide mental health services, but that probably represents about half of the total capacity. You can see our vision at the side there. We also have some statistics on families that we serve and groups and public workshops and presentations, just to give you a flavor of what the organization does. If we can move to the next slide, please. So I want to talk to you a little bit about the context. There's a lot going on in this slide, so I'll try and walk you through it. But the best statistics we have on mental health services funding come through the statistics we have on funding within the local health integration networks. And as you may recall, there's 2 local health integration networks that are at work within the region of Peel. The Mississauga-Halton-Lynn, which covers the city of Mississauga, give or take some small edge changes, and Central West Lynn, which covers the remainder, Brampton and Caledon. You'll see when you look at the slide that's here, the dark blue bars show the funding per capita for mental health spending across the province. Or sorry, that's addictions spending across the province. So you'll see Central West is the small bar third from the left, and Mississauga-Halton is the small bar second from the left. The left is not a good place to be in terms of funding. So you will see that per person, in Mississauga-Halton, where you're spending about 1/3 of what is being spent in Toronto, and about a little under 1/2 of what's being spent per person across the province. The same is true of addiction or mental health and addiction services. You'll also see the orange line where on the left you have the ratio of psychiatric beds to population, and this is quite stark. In Mississauga-Halton, you have 1 psychiatric bed for every almost 79,000 people, and in Central West, you have 1 psychiatric bed for every 66, almost 67,000 people. That compares to Toronto, which is less than 1/20th. Less than 1/20th the number of people per psychiatric bed. So that means that we have much fewer acute services and we have much fewer community services per individual. And I want to add a couple of items of flavor, just given the recent impact of COVID. We have also seen our own calls to our intake for services go up 40% in the last 3 months, and that's continuing to rise. And our calls to our crisis services are up about 30%. They're steady at 30% above normal, but it's still significant increase as a result of COVID. We also have heard through some recent surveys that have taken place across the country that currently 8% of the population rates themselves as happy in their home. That's almost 1/5 of what it is in normal times. We are also seeing that 2/3 of people are more worried, and 1/2 of the population is experiencing more anxiety. So those increases that we're seeing at our intake and our crisis services, I believe are only going to get worse as the effects of all of the social isolation carry on over the next months and years. Can you go to the next slide, please? So basically our call to action for the council is to help us in getting fair funding for good work. We're probably the best region in the province at doing more with every dollar, and we're stretching things. We have some of the best crisis services in the province. We have extremely dedicated and helpful individuals that are working extremely hard to try and meet the needs of our population, but still our wait lists for basic case management services are 6 months. And our wait times for some specialist services are even longer. The pictures on the slide show some of the good work that we're doing around the region. We recently donated a TELUS Health bus in the top left corner there, which allows us to serve the homeless population with both physical and mental health and addictions needs. And the inside of it is quite special. It's basically a state-of-the-art doctor's office on wheels. You see our intake workers, our work with the police down in the bottom left corner. We have had a crisis program in partnership with the police for many years, and that recently has added another dimension, which is responding live to 911 calls in a program called the Mobile Crisis Rapid Response Team, and that has already shown to reduce the number of people that are taken to the emergency department by police unnecessarily. So it's having a big impact. And you see our public education, and in the top right, you see the program that you fund us for, which is the Homeless Outreach Program, which has recently been expanded and will soon include 24/7 access and response. So fair funding for good work. Thank you.
Okay, David, thank you. And I was remiss in not carrying on. I had some other introductory remarks. I should have noted as well that both David and Carrie participated on behalf of their organization at last October's Community Mental Health and Addictions Roundtable with Minister Tabolo, who is the Associate Minister of Mental Health and Addictions. In addition, David and Carrie delegated quite passionately to our Health System Integration Committee of Council in late February. Given their impactful presentation, the committee requested the delegates to come to Council to share their presentation and perspective on the current state of mental health and addiction services needs in Peel. In order to support discussion today, I would also request that the approval of Council that we would please hold any questions until both speakers have had the opportunity to delegate. So with that, David, I thank you for coming up first. Carrie, you are up, and then we will go to questions.
Good morning. Thank you, Chair.
Good morning.
I'll just wait for the slides to present themselves. In the meantime, just to note, the Peel Children's Centre is in the process of amalgamating and will become Every Mind Mental Health Services. We are amalgamating with a sister agency, Nexus Youth Services. That agency is a sister agency that we've had a strategic alliance with for over 20 years. So you'll see on the front slide our vision, caring communities, working together for children, youth, and families, and our mission. We talk about the passion, inspiring hope by leading in the delivery of high-quality mental health services. Peel Children's Centre is the lead agency responsible for our community with respect to Ministry of Health, Child and Youth Mental Health Service dollars, which in Peel, we can go to the next slide, thank you, which in Peel is about $22.3 million. The region of Peel is home to 12% of Ontario's child and youth population, birth to 19. That's 343,000 children. As David said, the stats that everyone is very familiar with is that 1 in 5 children, youth, families at any point in time will face a mental health challenge. In Peel, there are about 68,000 children, youth that face a mental health challenge, and this is pre-COVID information, and less than 1/3 will access services. So the piece, if I can focus people's attention on anything today, and this is where the passion comes in, Peel receives $22.3 million for child and youth mental health. In Toronto, they receive 6 times, $6 for our $1. So they have $133 million to invest in child and youth mental health. On average, per capita, across the province, $66.6 million is available for child and youth mental health. That is 3 times what's available for a child, a youth, a family in our community. The social determinants of health within Peel are equal, if not greater, than in Toronto. And please don't misunderstand me with respect to judging Toronto's funding. There is great need, and there's more need across. This is an issue of inequity. To give you a snapshot of what that means, in Peel, we have one of the longest waiting lists for child and youth mental health services across the province. A child that's 5, 6, 7 years old will wait 737 days in some instances. That's 2 years. At the moment, we have 550 children under the age of 19 waiting for our counseling services. Next slide, please. So the call to action is very simple. It's focused And with all due respect to COVID, it pre-existed and it will continue to exist and be exacerbated in the months, weeks, and years to come. The children in Peel shouldn't have to wait. They can't wait for mental health services. The children, youth, and families in Peel deserve a funding formula that is fair, that is population-based, and that recognizes the social determinants of health. I would say that in the face of COVID, there never has been a greater time where all levels of government and the public have been so focused and open to supporting mental health. In Peel, working with David, working with CMHA Peel, working with our other service providers, working with the region of Peel around the community response table in the face of COVID, we will continue to collaborate. We will continue to innovate and integrate through this difficult period. We did it before, we'll do it now, we'll do it in the future. Peel, with its underfunding, is probably better at coming together and making a dollar go as far as it possibly can relative to any other community in this province. But if there is a call to action, it's let's get to the root cause. Peel's families, the children and youth, they deserve a fair share of provincial funding. And that is, for my vantage point, for the vantage point of Peel Children's Centre and the community, the only issue to be discussed. Thank you.
Thank you, and thank you for those presentations. Quite a list, because speaks to the concern all my colleagues have on council. My list is Santos, Downey, Vicente, Fonseca. Councillor Santos.
Thank you very much. And through you, Chair, thank you to CMHA, Peel Dufferin, and Peel Children's Centre for your presentation. And I imagine that we could bring those reports forward at this time and discuss them as well. This is a huge concern. I've expressed concern, and fellow colleagues have also expressed concern around this for quite a while. I actually don't understand why we continue to be underfunded, especially in this area around mental health, given our region is one of the youngest populations in the province, in Brampton in particular. In February, Councillor Vicente and I, together with Mayor Brown, had a roundtable discussion with principals of various schools and teachers and staff of elementary schools. And all of that staff, as CMHA, Peel Dufferin, as well as Peel Children's Centre were there as well. And all of the staff had expressed significant concern about children as young as kindergarten age, all the way up to high school, being suicidal and doing self-harm. And one student nearly threw herself over the second floor of a stairwell of a school. We have students who have been involved in family domestic situations who are not receiving any mental health support whatsoever in literally the backyard of my neighborhood. And so I can't really and this was pre-COVID. Now, during COVID-19, I was on the phone with Orlando Bowen from One Voice, One Team, who is very in tune with young people here in the region. And he shared with me that because of the labor disruptions this year, because of COVID-19 and self-isolation, and because of now the incidents that are happening here in Canada and south of us related to anti-Black racism, our young people are expressing that they're feeling really hopeless right now. And because we're already behind on funding and wait lists and access to supports, and now our students don't even have access to talking to their teachers and their principals, it's even more of a concern. And in an area like Peel Region, where you have the majority of MPPs, yet again, representing the governing party, we still can't seem to get our fair share of funding. So I know in the report we're advocating, but I'm really asking that we advocate pretty aggressively on this. And I really think we should all be talking to our local MPPs and making sure that they know, and they know the statistics, and that we're expecting them to stand up for our region for our fair share of funding. So I do think CMHA, Peel Dufferin, and Peel Children's Centre and the staff for the report, but I'm really pushing us to be aggressive on this one. Thank you very much.
Thank you. Councillor Downey.
Thank you, through you, Chair. Thank you very much for the presentation. I think that Councillor Santos really wrapped it up very well, and all of her points are well received. I couldn't agree more. In terms of the advocacy piece to our provincial partners, what I'd like to see through our Government Relations Committee would be we've talked about having these roundtables, and the mental health roundtable that we hosted with Minister Polo was very well received. We need to do it more, and we need to have more of our MPPs at that table. And in the time of COVID, whether they are Zoom meeting, lunch and learns, whatever it may be, our MPPs, most of whom are new to office, really need to know and understand what's going on in Peel. That's not to say that they don't, aren't in tune with their own communities, but as an entire picture, I think that we really need to have these discussions with them. As Councillor Santos mentioned, we have a huge voting bloc in the Conservative Party, and we need to utilize that. Thank you.
Thank you. Councillor Vicente.
Thank you, through you, Chair. Just want to, I think Councillor Santos articulated our position very well. Thank you, Councillor Santos, for speaking so passionately. This has been a problem that has plagued the region of Peel for as long as I can remember, looking at the issues coming here from the region. The region has, for a very long time, the growth here has outpaced the rates of increase in funding from the provincial government, and it's sometimes ironic to hear past government officials speak so glowingly about how efficient we are here in the province of Ontario in terms of the amount spent per person. And that exhibits itself in this, a lack of funding for organizations. And, our heart goes out to them for working so hard and doing more with less. But I agree with the speakers before that we need to really push the provincial government. As they are working, they say, to fix this problem, we want to make sure that we are not remiss in pointing out this disparity or the inequality of the funding as it is for the region of Peel in comparison to other municipalities here in the city of Brampton. The COVID situation has, I think, illustrated very vividly that in a large urban center like ours, the situation can be different. There are additional pressures as compared to other parts of the province. And Councillor Santos is right. So when we visited those schools, we saw firsthand just how unfair it is that our kids are not being supported properly. Our residents who have mental health issues are not getting the same level of support as other parts of the province. And so I know that Chair Ainika mentioned in our committee meeting that if there is one thing that we as a region need to advocate more for than anything else, it is for this issue and for the province to come forward and to recognize that we are a municipality of over 1.4 million people. We have greater need, and we, for decades now, have not been funded fairly. Thank you.
Thank you. And I do want to note for, in terms of the paperwork, Councillor Santos did call the clerk early on and wanted to be sure to be moving these items, but Councillor Vicente, with the same concern, asked for the same thing. Madam Clerk, and to my two colleagues, I'll let you think about whether one of you might move receipt of the two speakers, 7-1 and 7-2, with the other to second, and then perhaps the second one of you could move 13.1 and the other one will second, just because I think we've stepped into it a bit because the left hand didn't know what the right hand was doing. I hope my two friends can figure that out while I carry on with the list, which next would be Councillor Fonseca.
Thank you, through you, Chair. Oh, it's all been said already. Thank you, Councillor Santos, Downey, and Vince, in particular, Councillor Santos, for emphasizing the need for pushing and advocating and really bringing in the local MPPs in the region of Peel in a way that tries to get the message across to them, to be able to bring to Queen's that we need fair funding for good work, which has been presented in David's presentation, and to carry a focused, fact-based, root cause call to action. I mean, the numbers are the numbers are staggering. They have been this way for as long as I have been on council, and I'm sure that other councillors that have been on council at the Region of Peel will echo the same. The frustration is it's unbelievable. Just in my time on council, going through ways that the Region of Peel has advocated, whether standing committees at Queen's Park, whether having MPPs or ministers come out to roundtables at the Region of Peel, whether the regional chair, whether chairs of different committees at here in Peel and councillors locally, and as a table of councillors represented from right across the three Caledon, Brampton, and Mississauga. The province continues to nod its head and say, yes, we recognize that this is an issue, while at the same time, nothing has changed. And as Councillor Santos has said, COVID has only underscored this, but this has existed for an extremely long time. So anyway, I support in any way possible that we can, the call to action, however we can not only get the message across, but actually make a change and get that message through to the MPPs in terms of advocacy is only been heightened now through COVID. And I think I do want to thank Carrie and David for being here. When this was presented at the Health Systems Integration Committee, a lot of questions the councillors on that committee were asked there. And you know what I have to commend everybody for is that, and Councillor Vicente, you touched on this, I don't understand how in Peel region over history and over time, the region of Peel has always come together time after time after time to do more with less. We are always doing this if you go back in time. And when you look at the social service supports, when you look at inequities in funding for housing, when you look at inequities in funding for youth, children, seniors, any sort of public health, the province has a history of continuing to throw at us, okay, you have to do more with less. We continue to collaborate and work with our partners, our agencies, and show that we can do more with less. And this seems to always work against us, which is extremely unfortunate. The comparisons that Carrie made with regards to the 6 times amount of funding that goes towards children and youth in Toronto is staggering. But what I think is even more of, frankly, a slap in the face to the region of Peel is the 3 times more provincial average that Peel is not getting when it comes to children and adult services when it comes to addictions and mental health. Very concerning in that we continue to show best practices. We provide those best practices. We showcase those best practices and show that we are being very efficient and being very effective with the funding that we do have. And yet we continue to just basically get a nod that, okay, it's great, you're doing more with less. While at the same time, other regions and other municipalities are getting more. So very, very staggering numbers. I do want to say and thank all partners and everyone that has, in light of this, put this this call to action together, and focused in on opportunities. Opportunities, again, not asking for more, but asking for what is fair for children, youth, and adults in the region of Peel when it comes to not only inequitable funding, but to try to address opportunities as to how to address that inequitable funding in a very reasonable, responsible way, but also to address the growing wait list, and also providing an opportunity for not only the region of Peel, but the entire province to work on providing a better structure framework through a center of excellence. So I don't have any questions. I fully support what is here, what has been before us today. I do want to thank Carrie and David for everything that you have presented at the systems integration table, and also for being here. We felt that it was extremely important that you come and present before regional council, so thank you for being here. I think this call to action, again, is focused, it's fact-based, it gets to the root cause, and it provides opportunity for children, youth, and adults in the region of Peel, and also another whole set of best practices that the province can benefit from. Thank you.
Thank you. Councillor Medeiros.
Thank you, through you, Chair. This seems almost like Groundhog Day. You know, the scenes where every day we sort of, since I've been on council, and I'm sure many colleagues, you know, we talked about the Fair Share campaign, and at the time in last council, we were going to do, I think, a week advocacy, and then after we had some questions regarding the numbers, they weren't so clear. And, you know, the disconnect we talk about, and I see everyone's passionate about, you know, how unjust this is, and certainly it is unjust, and certainly everyone's already characterized the argument. But it just seems we've reached a point where we just can't continue to do the same thing. And call it advocacy days, call it call to action, call it, you know, we've all spoken to MPPs, and it just seems to keep going. There seems to be the same grind. So, and I refuse to believe that, you know, folks at the province maliciously point out to the region and say, let's underfund them. So there has to be either some flawed formula or flawed technical sort of appreciation or analysis that leads us to always be in this chronic underfunding, state of underfunding. You know, and I don't know if it's maybe the organizations, and you can see from the report and we know from the data, but just outline, for example, for anyone who's watching out there and to media, talk about outcomes, talk about the return on investment, because for what we do with less, the type of service you provide, we're going beyond. So if you know, bureaucrats are at the province and they're analyzing the money that's been funded and flowed to the organizations or to the province, to the region, to then to partners, and we're providing these high service levels, where is the disconnect? And now, you know, I'll give it first to the organizations, and maybe to staff can talk to me about what discussions and what's the rationale when there are, you know, meetings of the minds and we're around a table and there's recognition that every other region is getting their fair share except Peel Region. We're hitting our service levels. We're going beyond. There's a huge need, but we sit here year by year by year and get into the advocacy days and speak to MPPs and so on. So where is there a disconnect? And maybe the organizations can maybe comment themselves. I'll start with you, David, and like to hear your feedback.
Thank you, Councillor Medeiros. Yeah, in adult mental health, the issue is that, or mental health and addictions, the issue is that funding formulas tend to be based on what happened last year plus X%. And that would work if the population levels were steady, but of course in the region of Peel, you're seeing growth in the neighborhood of 4 or 5% over decades, which means every year we lose ground. So if you get a 3% increase to base funding in Peel, that means a 1.5% decrease versus population growth. Whereas in areas in the north where population is actually decreasing, then you're seeing a net increase of 6 or 7%, whatever it is, right? So the challenge is that they base funding on last year's plus 1% because in adult mental health and addictions, they don't have a population-based funding formula for community mental health. I think Carrie will tell you that in children's services, they've gone further and they actually have a population-based funding formula, which could show, shows the inequity even more. So the problem is just that they tend to base increases on what happened the year before. So where population is decreasing, that's an advantage. Where it's steady, then it's a mild advantage. And where population is growing, it's a huge disadvantage.
Carrie, did you have a thought on that as well?
David's bang on in terms of the historic inequity. And even with the change in funding formula, it would result in stopping the water going through the dam, but it won't redress the historic inequity because of flatline funding. In terms of child and youth mental health, it's not even last year's plus a percentage for cost of living. It's flat funded year over year over year. What I would say is that in the absence of new investments in child and youth mental health or adult mental health and addictions across the lifespan, government doesn't want to take away, particularly when they're justified needs. So who would want to take away the 6 times amount of funding that Toronto receives when there's true need there? So that's problematic. So the strategy with government, and this is a nonpartisan issue, the investment in mental health and addictions in the Child and Youth Centre came out under the Liberal government. It's a matching program between the federal and the provincial levels of government, $3.8 billion over 4 years under the Liberal regime, and under the Conservative pre-COVID, the same investment over 10 years. And at the point of the Liberal government and then moving over to the Conservative government, in both instances, there is a funding formula, which is why I've highlighted this in the report. There is a funding formula that has been worked on, that has been agreed on within the bowels of government. In both instances, at the point of it being moved to implementation, there's been a change of government, something's happened and it's stalled. So I do think that there is an opportunity for the region of Peel to be having conversations very specific around when are you releasing the funding formula, and even in the face of COVID, where is that money going to be invested, and making sure that it doesn't end up being the purse strings being loosened to address other issues that are COVID related and watered down in terms of what that investment was intended for, which was with respect to services and services disproportionately allocated to the Peel community with the release of the funding formula.
And I guess just lastly through the chair, and you touched upon population. So for example, a city like Brampton that sometimes estimated between 50 to 100,000 people go unaccounted for based on our illegal basement dwellings and in terms of multi-generational households. Do you find that provides pressure and is an impact on in terms of our financing and us being chronically underfunded? So do they look at sort of the population based on, census numbers, look at your service levels and so on? Does that come into the formula?
I'll speak first for adult. I don't think it has an effect, to be honest. They simply don't use population numbers or statistics to help determine the funding formulas. It's very simple. Last year's plus X percent or last year plus 0, as it has been many years.
Yeah, and it's the same in child and youth mental health, but the funding formula that is on the table that has not been released does recognize the social determinants of health. So the health of the population in Peel, the rate of homelessness, the amount of poverty, it is factually worse than Toronto. We always hear about the social determinants of health and how challenged the Toronto environment is, which is true. We have the same issues in Peel, and it is fact-based, and government has recognized that in the funding formula that has yet to be released.
Okay, thank you very much.
Okay, thank you. Thank you. Councillor Sato.
Thank you, Mr. Chair, and thank you both for being here today. I think Councillor Medeiros, you said it well, it's like Groundhog Day. The number of times that we've been here hearing and saying the same thing. I was thinking back to, gosh, I had to be 25 years ago when I sat on the Credit Valley Hospital Board on behalf of Mississauga Council. And at that time, we got monthly reports on services within Credit Valley Hospital. And one of the reports that we consistently received, which several people around this table will recall, was for psychological services, particularly for youth. And the waiting times were 6 months to a year and up. And it's really sad that those numbers haven't really improved. And in fact, right now, I believe if I was to look at those numbers, they're probably a lot worse than they were back then. But, you know, we have never had a champion at the province of Ontario, an MPP champion, to push our, I don't want to call it agenda, but our needs within the region of Peel. And yes, we have been woefully underfunded, and we've been told why we've been woefully underfunded. It's because we're too efficient. Mississauga was constantly being told that, yes, we're giving Toronto 300 million, so they don't have to raise their taxes because they haven't managed their budget well, and they're going to run a deficit, and they need the money, and they haven't done this, they haven't done that. But you guys have done a really, really good job managing your money, so you don't need any more. And we got the same attitude at the region of Peel. So yes, we've been punished for being efficient, for managing our money, for keeping our taxes low, and it's been a source of frustration the entire time that I've been on council. But the reason we formed the Health System Integration Committee several terms ago was it was because we wanted to bring together people who from the health services who could work with us around the table to address these issues and to be our advocates, to speak with us. So we weren't just the government voice, we had the provider voice. And we brought together Trillium and the Linds and a lot of other people. And it was appalling. I think it was last term when I chaired the committee back then, and I had a chart. I asked staff to bring a chart forward, and we had to put it on, I believe it was ledger paper, and even then it was so large you couldn't read it. And it wasn't just the funding that was the issue, it was the navigation of the system. That, even if the services were there, nobody could ever find them because you had to go, yeah, you're both nodding your heads. You had to go through so many different routes. And if you were a person who had any mental health or addiction issues, just going through that process was frustration and was difficult for you to do. And even if you didn't have any of those issues, by the time you got through, you probably had some because it was so difficult. At that time, we invited our MPPs from all across Peel to come to some of our meetings. And we had one who agreed to come, and then we didn't. It didn't end up coming, but we have not had the support from the MPPs. And without that, we're not getting much at Queen's Park from any level, from any government, any party. Councillor Medeiros, I think it was you as well that said we need to talk about return on investment. And you're right on there, because the only advocacy that has worked with the province of Ontario over the years from the region of Peel has been showing a strong business case. If you, speaking of the province, if you provide this amount of funding, this is how much you will save on the other end. And that's where the members around the Health System Integration Committee come in, because they can show from the hospital side, if you provide the funding here to the services, community organizations that are providing these services, you're going to save on hospital visits, et cetera, et cetera. You're going to save on policing. You're going to save on a lot of other services that are going to cost a lot more. So I fully agree that if you're going to go to the province, you're going to ask for funding. We did fair share for Peel. Nobody down there really cared that we weren't getting our fair share. You know, we talked about it for years. We had all of the data, we had all of the statistics, all of the finances, and you both know this, you know, and it fell on deaf ears. So I really think, Councillor Medeiros, we've said it before, it worked with the with daycare. You know, when children's services, when we said that for every dollar you put in for daycare, you saved, I think it was anywhere from $4 to $8 on Ontario Works funding because it allowed parents to go out to work. And that was the kind of argument that we found the departments at the various ministries listened to. So, David, your comment about the funding, that, you know, there hasn't been a growth related formula in the funding, and that it keeps getting bumped, the new formula. You know, COVID is just making it worse. It's just escalating the problem. And I'm really concerned that, you know, the government is, I think, Carrie, it was you that said that government, we don't want them to use the funding for, flow the funding into other uses because of COVID. So we need to really work with our counterparts, you know, whether it's the mayors and chairs, the AMO, or whatever it is, the other regions, to say you can't take the funding that has been promised for years for mental health and start flowing it somewhere else. You know, I mean, I just don't know how they're going to find the funding. It's very difficult because of all the costs that the province and the feds are getting. But we really need to keep it out there that mental health, if you don't have the mental health services, then all of the other all of the other blocks will fall. You know, and the economy. I think we almost need to tie it to the economy as well. If people have mental health issues, they're not able to work, they're not able to contribute to the economy. All of those arguments are the ones that we really need to keep making to the province, and through the support of the members that are around the table at the Health System Integration Committee. You know, we really need to make that point and get it out there. But I appreciate you being here today. I think we're all very frustrated with this. We've been very frustrated for years, and you know, let's hope one day that we don't wake up and it's another Groundhog Day, Councillor Medeiros, and that it happens very quickly. Thank you.
Thank you, Councillor Groves.
Thank you, Mr. Chair, and I agree with all the previous speakers, and I too recall, I think, Mr. Chair, you may recall, we did have a few MPPs who attended a roundtable with us a few years ago, and I actually was pretty shocked that some of these MPPs didn't even know what their responsibilities were. And we brought them in because we were at that time advocating for our fair share in Peel Region. And again, we haven't seen any changes. We haven't seen any additional funding. We're still underfunded. So here we are, how many years later, and we're still underfunded. With respect to the mental health with children, Dr. Davila had written a report, and I remember when she wrote that report. In the report, it speaks about suicide among young children. Young children in as young as 12 years old and under. That is a very scary thing. And to Councillor Santos's point, we don't have school in session. At least when the school's in session, they have guidance counselors. They have resources available that they can tap into, but not having that becomes a huge problem. And it's very concerning. The suicide part of it is very concerning. We've also heard from our health experts that with this whole pandemic, they are seeing an increase in mental health. And it's in children, it's in seniors. I think it's going to be in almost everyone when this is all said and done. So I don't know what this funding formula is, but maybe the funding formula isn't working. Maybe the type of advocacy that we've been doing isn't working. As Councillor Santos said, maybe we need to get a little more aggressive, Mr. Chair. We are one of the largest regions in Ontario. And Councillor Sato, you're absolutely right. We have been very efficient, and I will say that Peel Region has been very fiscally responsible over the years and in managing our money. And so we're being punished for that. Doesn't make any sense to me. And to Councillor Sato's point as well, all of the other services are going to be affected because of mental health. Hospitals, we know they don't have enough beds, they don't have enough funding, social services. It's just a mess. So I don't know what we do, Mr. Chair, because we have been, our advocacy, it's been falling on deaf ears for all the years that I can recall. So I don't know if we change our strategy. I have no idea. So I will leave it to you, Mr. Chair, and all the staff that we have in terms of coming up with some other type of strategy. And I think growth should be part of this. The region is taking a lot of growth, and we've taken a lot of growth over the years, and growth should be part of the funding formula. I don't know what the new one looks like, but it should be. Thank you.
Thank you, Mayor Brown.
Thank you, Chair Nika. So I know this is feels like Groundhog Day when we're always talking about our fair share, but I also think there's an opportunity here. In mental health right now, there's never been more money spent in mental health in Ontario than there has been before, and they're figuring out how to properly allocate it right now. And I know a great deal about this. I remember when I was in the provincial legislature, the platform I put forward in November of 2017 called for $1.8 billion matched by the feds for $3.6 billion over 10 years. A month after we released my platform, the government of the day announced the same thing, but about 5% more. So all of a sudden, it was a competition of who could spend more on mental health, understanding this was a gap in the healthcare system and the wait times were unconscionable. And the reason there was a pretty universal response is the wait times no one could defend. They knew this was a dirty secret within the healthcare system, and that's how we described it. It was a dirty secret at how we cared and responded to mental health concerns in Ontario. And so I know there is a lot of vulnerability and sensitivity around this at Queen's Park. And if we write a letter as a council, it will get lost, it will get ignored. What I found in the provincial legislature, there was the most sensitivity around is when you talked about real people's stories, when you talked about wait times. And so if it takes a certain amount of, if it takes 8 months for youth that is suicidal to get counseling, and I'm not sure if that's the wait time, but what we need to do and to get from this call to action is these stories. What are the wait times? And if the wait time for a young person in Mississauga or Brampton is dramatically different than the wait time for someone in Ottawa or London, how can our local MPPs defend that? How can they stand for that? And if it's a private letter sent to the MPPs and the Minister of Health or the Premier, that doesn't get much attention. And this call to action should be matched with a more visible campaign. And what I'd like to see is this is the wait time for adults. This is the wait time for young people in Peel, and this is what the wait time is elsewhere. And find the greater contrast. And you look at some of the wait times for youth are unconscionable, but for adults, unbelievable. And so is that something that's possible? Could you get us stats and a comparative context of what the wait times are for these critical services? And are there examples that you could share with us today that speak to why it's more acute in Peel Region?
Through to David and Carrie.
Yeah, it's as I was listening to some of the conversation, there's another thing to remember in that about 2/3 of the people that need mental health supports in Ontario don't seek them because the wait times are so large. So you have this effect that once a wait list gets to a certain level of, I dare say, ridiculousness, people don't go on it. They just suffer in silence or suffer at home or seek private care. So there is a sort of a topping out of the wait times. But if you think that in our area it takes 6 months to get a psychiatrist, so that you go to your family doctor and you see that there's a need, they refer on to a psychiatrist for medication. Person waits 6 months. And those stories are everywhere. But people who need like food and housing and daily support, they're waiting 6 months. We can tell tons of those stories. But it's also helpful to remember that most people just give up and stay at home and suffer in silence and get some minimal treatment from their family physician and try to carry on. So that story, I think, it's harder to find, but would be useful.
And I guess what I'm trying to say is if we're trying to articulate that the lack of funding in Peel Region results in a diminished service, we need to speak to what that is tangibly. And so if another area of the province gets a funding that is on a different level per capita, how has that affected us? And that's what we need to articulate. And what I'd like to say is if we can find clear examples of how that diminished service has affected families and people in Peel Region, then I would put that poster on bus shelters. I would make our ask not a private ask, but a public ask, saying, who's going to be the champions, and direct people to our MPPs to be our champions on this. And so, what does this mean for Peel Region? This diminished level of funding for mental health. What does that mean for Peel Region? How is it? What are tangible examples of how it's affected us compared to other regions?
Yeah, that's right.
Are there examples you could share with us today?
Well, there's hundreds. There's literally hundreds of people on our wait list that have been waiting for 6 months, and in the time that they're waiting, they lose their jobs. They end up going on further on to social services. They are end up going to the hospital when they didn't need to previously. So all of those things are effects.
Mm. And so. Are we able to show that in a comparative context, how it's harder in Peel Region, or is it difficult to do so? And if it's difficult to do so, it makes our ability to explain why we need to have funding increased on a per capita basis, and it makes that argument harder. But it brings back memories. I remember asking questions in the provincial legislature. I had families write me and say, the time I waited for a psychiatrist, my son or daughter took their life. Like, there were examples of where the wait time was tragic, and the government had no answers at the time. It's one of the reasons there was this influx of investment. We need to have those same local examples that we can share and compare. Like, I used to compare what the wait time was in Ontario elsewhere. We need to be able to compare what the wait time is in Peel Region to elsewhere in the province to show why this lack of funding has actually affected our residents.
Yeah, and we can do that.
That's the data we need.
Yeah.
There is a report from CMHO, the provincial association, that documents some of the pieces that you're getting at, Mayor Brown. It's not just Peel, so that we're clear. It is the GTA. It's outside. It's that growth area outside of Toronto that is underfunded for the reasons we've stated. in terms of flatline funding in the face of dramatic growth, not to mention the complexity that comes with the diversity we face. I mean, there's stories and there's stories upon stories, but what we ask for is for people at their most vulnerable sitting on wait lists to come forward and explain the impact, which is extremely challenging to do. It's a marginalized, stigmatized population. I think the crux of the matter is that mental health is it's not a socioeconomic preferred condition. It's 1 in 5. The facts are the facts. The mental health is exacerbated when the social determinants of health are being compromised. So it's a mathematical formula at that level. And what I would say in terms of opportunity is within the child and youth side of the equation, which if we can make ground there, would obviously be upstream to adult mental health concerns, but would set the road, is that we don't have to prove the case. The government, provincial government, nonpartisan, has recognized this issue. That is why there is a formula that is sitting on the table that speaks to the issue. So in fairness, we have made gains. We haven't seen all the benefits of the gains. And again, I speak from the child and youth mental health sector, but we have seen gains. The province, it's taken like 30 years, but there is an appreciation by government that Peel does not, and the GTA does not receive its fair share of funding, that the funding formula is a fundamental structural issue, and they've looked to address it. We have seen since 2000, just to be fair to the experiences and stick to facts, since 2000, when there has been a new investment in child and youth mental health, the region of Peel has seen a disproportionate amount. The allocations were made with consideration to child and youth population. So I think that we need to understand that what has happened is it's not become the way of doing business. It doesn't redress the historic issues. But the opportunity right now is in this new space of dollars that are supposed to be forthcoming, of investments, that the funding formula be used to move that forward. But that funding is within a COVID context. I'm not sure where that's at and have considerable concerns about where it might go. If I might, just a couple of other things to the David Dodge years ago, I think it might have been the mid 80s, wrote a paper that talked about the business, the economic investment in mental health and how it fed the economy in a positive way. So some of that work has been done. The other piece I would say to Councillor Sato's point around access points and the complicated, convoluted system or lack of system that has existed in Peel and has existed in the province in child and youth mental health. As lead agency with the Moving on Mental Health platform that has evolved with the change of government, lead agency was to take responsibility for putting a system in place. In child and youth mental health, we have a framework, we have logic. There has been a lot of progress made. In Peel, we have where-to-start.ca, which is the access mechanism to the child and youth mental health. We have Tangerine, which is the walk-in, so zero barrier. It's available just 3 days a week because there isn't enough funding. And we have the crisis service for under 18. And we're working more closely with CMHA Peel in terms of crisis services because there's integration work that needs to happen there to make it simpler. So for child and youth mental health in Peel, we have become pretty efficient. And there are three ways to get in crisis, Tangerine if you've got a single issue, or to phone and to kind of come through the front door. So just wanting to kind of round out and balance. I think we're looking for the tipping point now, right? And if we can tip it in the child and youth mental health space, now that mental health and addictions has come together, then that allows us to start to tip it through the full lifespan of mental health and addictions. So I do see a lot of opportunity.
Well, Chair Inika, I guess on that note, I have no other questions. I just wanted to underline the fact that I think we need to have a campaign around this that speaks to examples and in a comparative context. And if what we're seeing in Peel Region is consistent with other growth areas, whether it be in Durham, because I know they had issues as well. And maybe there's some collective messaging that we can have to say that the GTA's growing suburbs cannot be forgotten in mental health funding. And I don't know what that message would be or what that campaign would be, but given the fact the government's making its largest, Ontario's never spent this much money in mental health. There is no better time to insert ourselves into that allocation. And so I know we can't always be on fair share, and that there are other asks. But I think when it comes to mental health, the stars are aligned for our ask. And I hope that what comes of this presentation is some direction that will lead to a campaign that is coordinated in Peel or beyond.
Thank you, Mayor Brown. Once the speakers are done, I've turned my mind to it and I have a thought or two, but I'll share it when our speakers have concluded. Councillor Fonseca.
Thank you, Chair. Sorry for being on the board a second time. I did just, with regards to advocacy and how we can better advocate. So a question, I guess, to both Carrie and David. So Carrie, you said, and you've emphasized now, we need to outright, when are you releasing the funding and that formula? That's one way. But when you look to the report and the discussion that we've been having right now, the system itself and the complexity in navigating it, in the report, it speaks to there are actually really and historically two systems. So you have a system for youth, 16, I guess 16 and under, or sorry, one for children and youth sort of 0 to 24 years of age, but one for adults 16 plus. And it's you've in your report, and you spoke to opportunities, and the report speaks to opportunities of how a centralized intake where intake from both of these two different systems could potentially, if we advocate for, or how can we best advocate for this kind of change in the structure, where a centralized intake that doesn't exist right now will help address perhaps some of the gaps that are existing because these two systems are in place. So perhaps it would eliminate some of those wait times if you have that centralized intake, whether they're wait times from with regards to youth in children in the one system, and or whether it's regard to wait times for adult services in the other system, and also advocating for that centralized intake. Will it also help to address providing the appropriate services to whether it be the youth, children, or adults? Is that something that we should really be pushing to advocate for in terms of a change in the system? So we've already talked about the need to advocate for the fair share funding, but when you look at the actual model, how can we best advocate for that centralized intake as an opportunity?
Yeah, if I'll take a crack at it first, Carrie, if you like. I think this is a solution that consistently is brought up. That if we had a better access, somehow the wait lists would go down. But those wait lists exist in every service. So it's kind of, I liken it to working better with your neighbor when your kitchen's on fire. It's not something that you can do within the existing resources. Carrie and I and Peel Children's Centre and Canadian Mental Health Association work incredibly well together. We meet, we talk about what services we can work together. We have projects together. We can look at centralized access, but it won't solve this underlying problem of resources. It will make navigation easier and better for families, which is amazing. great, but it'll be better access to waitlist instead of better access to services. And honestly, we've talked about it a fair bit. It's important to advocate for the resources so that we can start to move from those areas where we don't have enough service towards each other. But we have such demands on the system. It's very, very hard to try to centralize across those enormous gaps. We have to start to close some of the gaps so that we can get closer to each other to be able to do the centralization.
Yes, I would just echo, and on the slide, I talk about the root cause. We can continue to collaborate, innovate, integrate. We're doing it, we do it. The reality is the root cause is there are not enough resources. If there was a focus in terms of where these resources would be invested, I would agree that into the youth population, there is a dearth of resources available for counseling services for that transitional age. And by that, I mean really the 16 to 24, and counseling services that are within the philosophical framework of child and youth mental health, which is strength-based, which is not DSM-4, not psychiatrically diagnosable per se, that we do need resources in that population. Those youth sit on wait lists and then they fall off the wait list. It's a crisis in that space. But the root cause is resources.
Thank you. My list is Medeiros, Damerla, Groves, Sato, Crombie. Councillor Medeiros.
Sorry, it might have been an accident, Chair. I think it's from a previous request.
Okay, thank you. Moving on, Councillor Damerla.
Thank you, Chair. I just want to say that I've been listening to this very important discussion with a lot of interest, and I do want to preface by saying that having been a MPP, I can say this, that actually the advocacy has worked in the sense that there is everyone in government, particularly the bureaucracy, which is of course much more permanent, is very, very alive to the inequity that exists in funding. And so to that extent, the advocacy has been very effective. And I know the frustration is, well, if you're aware of it, why aren't you doing something about it? And it just comes down to dollars and cents, because there's only two ways to fix the equity and the inequity. One is you take away from Toronto and give to the GTHA. And I think all of us can agree that that really doesn't, it's like, what is it, robbing Peter to pay Paul. Toronto itself can argue that perhaps they need more resources. And the other one is to expand the pie. And that's where a lot of the challenge has been in terms of government's ability and appetite to expand that pie. So I'm not making excuses, but I am saying that actually the advocacy has worked to the extent that people are very alive. And I want to thank Sari for your recent intervention where you sort of showed how the advocacy worked in the children mental health section, because I know over a period of, I can't remember, I think it's 12 years or 20 years now, I've forgotten. I guess the ring around Toronto will catch up with Toronto. So it's been done slowly every year, a little bit of increase. And I remember as an MPP saying this is a good start, but we need to do it faster, not over this long period of time. But it really came down to, do you take from one area to give another, and how much can you expand the pie? And so to Patrick's point, or Mayor Brown's point, I think the opportunity is when there's a new pot of money, because at this point the legacy piece is hard because you have to take from one to give another. But when there's a new pot, there's absolutely no excuse for any government to not give Peel or the regions around us our fair share. And so I think with these new pots opening up, I agree that another round of a really well done campaign is really important, because we can say that this time you can't forget us, like this time, and there's new money. And Chair, I just wanted to raise another issue. And I don't know where the, I was going to ask it during council inquiries. I'm not sure the right place, but I do feel that there is another opportunity, and that is that, when we deinstitutionalized the treatment of mental health issues, we never put in the supports as a province, and I see Carrie's nodding, we never put in the supports to say, if you deinstitutionalize, what are the supports you need to complete that transition? And because we didn't do that, a lot of it has become a policing issue, and unfairly so for everyone. And I see David nodding as well. And I think given today's climate, there's a real opportunity for us to go back and relook at what does policing do well. And as we talk about refiguring out the priorities, are there pots of money that are being used now to use police to help in mental health issues or intervention that can be used more upstream? Because we're talking a lot about, I don't like the word defunding, but I do like the idea of reprioritizing what police does and making sure that the money that we give police is to do with the things that they can do well. And are there pots of money there that are being used inefficiently to deal with issues like mental health through policing that can be reprioritized to actually use in a more humane and more constructive way, perhaps. So there's probably two opportunities: new pots of money that open up, but also to look at how systemically, given what's going on with policing and all the questions in the public's interest, is there an opportunity there to look at how do we realign services? And I don't know what that forum is, what that table is, what jurisdiction the Region of Peel has in that. As council and chair, I'd look to you for some responses on that.
Thank you. And Councillor DeMera, it's a timely point. You'll have the privilege of putting that question to the Chief yourself in 2 weeks' time when he'll be before us at Regional Council. I'm sure it's one of the things he's going to want to speak to as well. Thank you. Moving on, Councillor Groves.
Thank you, Mr. Chair. And just on another point, and David touched on this, the lack of psychiatrists. And having been an owner of a medical clinic, I can tell you that some of these psychiatrists are not even taking on new patients. So that becomes a problem in itself. I've got a psychiatrist here. He's an international grad. He specializes in geriatrics. He's trying to get another doctor to supervise him because that's the process, unable to do so. So I think, Mr. Chair, when we're doing this advocacy and we're talking about funding, we also need to be speaking to the province about how they are handling these international medical grads, because there are many here, but the problem is they can't find other doctors to supervise them. And in order to be able to practice here and get their license here, they need a supervision of, I think, 12 to 18 months. So it's a shame that I have this amazing psychiatrist who specializes in geriatrics, but I'm unable to find a supervisor for him, a doctor to supervise him so that he can get his license here and practice here. So you might want to consider that, Mr. Chair, as part of the advocacy, that it's not just a funding problem. Thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chair. So apologize for getting back on, but I wanted to get to the motion that's in front of us. And I have a question mainly for David, but either one of you, Carrie or David. So you spoke about the funding formula hasn't come to implementation yet. But the funding formula is there. It's been through several governments, and it's sort of been, like a lot of things, sitting on a shelf. If the funding formula was approved, would it resolve a lot of the issues and a lot of the concerns that you have brought forward?
Yeah, so I can start. There is no funding formula for adult services. So above the age of 16, the funding formula to which Carrie's speaking is for child and youth.
Okay.
And they have nothing that matches that in adult services. So in some sense, we're even further be away from a solution in adult services. But I'll pass it to Carrie because it's not that different. Like if you look at the needs in child and youth, the main difference is just the demographics of how many people are over 16 and how many are under and how many are over 24 and under. But the same underlying socioeconomic issues apply to both adult and youth. The outcome would not be significantly different, but the funding, we don't have an actual funding formula in adult.
So if the funding formula for children was applied to adults, that would help?
Absolutely, yes.
Okay. And Carrie, I'm not going to ask you to respond to that one because I think it was very clear. So I guess my concern is that I don't think the motion goes far enough. To me, it sounds too much like motions that we've been passing for the last 25, 30 years. And I look at it refers to the key priorities for action. And I would really like to see that a lot stronger. You know, the key priorities, sorry, I'm trying to scroll down here on my other. So again, the key advocacy priorities, maintaining dialogue. Okay, that's fine. Raising awareness, we've been doing that, and working through community partnerships, just to kind of précis a little bit. I'd really like to see in here, in the recommendation, something that specifically speaks to the funding formula. So, you know, there's no recommendation that says that the province, that we are asking the province to move the funding formula for children, and thank you for clarifying that, that has been sitting for several governments, to move it to the implementation stage immediately or within whatever number of days, and make that one of the key priorities. I understand that that will come out through dialogue, but that's not really clear in the report, and it's certainly not clear in the recommendations. So, I would like to see also, if we put that in the recommendation as a very strong ask, that we also have a similar recommendation for the adult services that relates to that the province of Ontario be requested to immediately implement, in both cases immediately, it won't happen, but we can ask, implement a funding formula, and then give the actual specific funding formula that we want. You know, I know you've worked through it, you know what will work. I just feel that what we have in front of us is just the same as what we've always done. You know, let's advocate, let's talk, let's do this, let's do that, but let's really get, even if we add in a couple of really concrete recommendations. And to me, the most concrete recommendations are those funding formulas. That's what I've been listening to both of you and reading the report and going back over it again. You know, if you can get those funding formulas implemented, as in the case of the children's services, if you can get a funding formula formulated and implemented in the case of the adult services, that's a very concrete ask. And I don't see concrete asks in our recommendation. So I just wonder if one of you could speak to that, and maybe staff can speak to that. I'm not sure who that would be at this point. I'm kind of looking at my board. Whoever wrote the report.
Yeah, and that, perhaps I'm going to put you right through to Commissioner Granger if she has a thought on your sentiments.
It was Kathy. Sorry, I hadn't scrolled all the way down.
Through you, Mr. Chair, thank you, Councillor Sato, and thank you to all councillors for your passion about this issue and your support for it. We're happy to work on taking the motion away and strengthening it. As recent as last week, the chair did reach out to Minister Tabolo to ask where we were at with the funding, but we're happy to strengthen the motion and look at some more pieces related to the funding formula. We can take that away and work on that for sure.
So I would then ask the movers of the motion if they would agree to a friendly amendment to have specific references to the funding formulas, both for the children's services and for the adult services, inserted into the recommendations that are before us today.
Councillor Sato, I'm going to read what we've got. The clerk will read what we've got at this point.
And further, that the province be requested to immediately implement the funding formula for children and youth mental health services. And further, that the province be requested to immediately establish and implement a funding formula for adult mental health and addiction services.
Okay, that's what I'm asking. And if our presenters feel that that's an appropriate ask at this point in time, it's a concrete action that we can take. We can do all of the other negotiating and everything behind the scenes, but I think it makes it very clear that as a council, this is what we want done today.
Thank you.
Can I just add one response, because they do have funding formulas. I think what we want is a population-based funding formula.
Okay, yeah, that's fine. Yeah, I'm open to the wording, and it's not my motion. I think it was Councillor Santos and Vicente. I think we're moving this one. So I would ask if they would consider adding some wording of the appropriate wording that gets to what we're trying to do here to their motion. Thank you, Mr. Chair.
Thank you.
If I could I just
Sorry, go ahead.
add, sorry,
Yes.
It really is fair population-based and gives consideration to the social determinants of health. That is the funding formula. Just to go back to what one of the councillors said previously, that funding formula for child and youth mental health is there. It has been used. What we're looking at is that $3.8 billion over the 10-year, because with the funding formula, in the absence of new resources, there's no change. So it's not just having the funding formula, it is having the funding formula and having that play out with respect to the investments that have been promised and that need to be realized, particularly in face of COVID. So just to be clear on that. And I do want to echo what the MPP said earlier. She's bang on with the issue. Either you're taking away from another jurisdiction in order to get fairness, some better level of equality, or it is with respect to new investments. And that's the challenge. With new investments, it's easier and less painful to make movement. It doesn't redress the historic inequity, but it does start to stop up the dam, and it does allow us to make progress, and it does allow us to make new investments. And so to Councillor Sato's point, yes, it would make a difference.
Okay, thank you. Mayor Crombie.
Chair, if I'm on the board, it's inadvertent. I think all the points have been well made, and this is not a new issue for us, and I'm very supportive.
Thank you. Councillor Santos.
Thank you through you, Chair, and thanks to all my colleagues and Councillor Sato for bringing forward that friendly amendment. I would take that as a friendly amendment, and in the meantime, I've had a number of other colleagues who have also mentioned to me that perhaps we need to strengthen this motion even further and be, as I mentioned earlier, more aggressive on this. In addition to what Councillor Sato had mentioned, I think that Mayor Brown's suggestion to put together some sort of a campaign that illustrates the real personal stories that have been impacted with our young people and adults in relation to the lack of funding we've had over the years in Peel is also super important. And so I'm wondering and would like to test the floor to see whether or not we can take the time, as Kathy Granger, Commissioner Granger had mentioned, to strengthen this motion even more so and get it right and bring it back to the table at the next council meeting so that we are aggressive. We include the comments and this thorough discussion we've had today, because I'm not convinced or confident based on this conversation that we have this motion strong enough yet. You know, I've had colleagues message me saying maybe we do need to declare a mental health crisis here in the region of Peel just to get their attention after so many years of trying this softer approach. So I'd like to test the floor and see whether or not we should refer this back to staff to strengthen this further based on our conversation today.
Thank you, Councillor. And I have a thought on that as well, but I'll continue on with our list. Councillor DeMerla.
Thank you, Chair. I like Councillor Santos' idea of just coming back with a more thoughtful motion. I would like to add one thing, Kathy, to that motion, which would be to say that, you know, to advocate very aggressively, really, for the new part and to put in language that says correct historic inequities, you know, through the new pots of money. And I think that's really important to put out there to say, and so I'd like to see some language around that so that that message is very clear that, you know, no point banging your head against a wall around the legacy piece. It's very difficult to fix that. But I think if our motion really speaks to making sure that we will not take inequity with new rounds and some attempt to actually compensate. So, you know, it's one thing to say this is a new pot of money and everyone gets it equally, or this is a new pot of money, but the areas around trying to get a little bit more to correct for the historic inequities. I'd like to see that language in there, subject to, of course, my colleagues supporting that. Thank you.
Thank you. With that, if I could just make a comment in the hopes of being helpful, and I'm going to try to be very, very brief. First, to thank Carrie and David for having been here, but just a couple of thoughts, and I hope this moves us in a direction that may help get us out of this conundrum. I appreciate all the folks that have made reference to Groundhog Day. I see it a little bit differently. I don't know how many of you remember your Greek mythology, but if you remember the phrase a Sisyphean task. Sisyphus was the person that was condemned to roll a boulder up a hill, and the hill didn't have a plateau, so it forever rolled back down, and he was condemned to roll the boulder all his life. I feel like I've been rolling it for 32 years, and it's gotten us nowhere. So that is the fact. The other black humor joke that rolls in my head is a little clip I tell myself from time to time. I imagine you're watching this little clip on TV, and it's somebody picking up a phone and says, Peel Suicide Hotline, financed and managed by the province of Ontario. Please hold. That's the other black humor that I have when I think about where we've been in 32 years. But that's not going to get us anywhere. To Councillor DeMerla, you're absolutely right. The solution involves robbing Peter to pay Paul, but Peter was robbed in the first instance from us. It's our money that they're spending, so you've got to redress that. I don't know that they're going to fix it, but I think the point has to be made. Commissioner Granger made an excellent point on Monday when we were reviewing the agenda. This is not what she said in totality, but she gave me a little snippet of something, and she more or less said, and I'm adding to it, these are my words, you know, after all these years, like it's not working, or, you know, this is me talking, the definition of stupid is doing something over and over again and expecting to get a different outcome. And after 32 years, I feel pretty stupid. Like, we haven't gotten anywhere on this file. There have been some modest changes, et cetera. So it got me to thinking that what might make sense is what I'm calling the white flag campaign. Listen, let's put the regional chair out of his misery. Let's help Councillor Santos and Vincenti. They're not dumb people, even if the chair has been for 32 years asking for the same thing and not getting it. Can we at least start their careers by not them having to waste 30 years? So can we reach out to the MPPs and say, can you kill it off? Just say no, you're up for re-election in a couple of years. Tell everybody, we've done you a big favor. We finally said no. Those dummies you elect have accepted it, and at least we've wasted, or will no longer waste 2 hours at your local council meetings. Can we get to that point? Because we're out of ideas. But of course, none of that's going to work, and I realize that. The reason I have some hope, and what I am proposing to my colleagues, and Councillor Santos, I thank you because you've given me the window. I've known Minister Tabolo for 35 years. First thing he and I worked on was a charitable item back in Mississauga that was successful. He's gone on to a distinguished career as a lawyer, and in his spare time, you may be aware, and in his time as a minister, has gone offline to get his doctoral degree on addiction and mental health. He genuinely cares. And it's this rapport that had him pick Peel to have a round table to discuss the future and what we can do. And so what I would like to do is to convey to the minister these next 2 weeks in person. Michael, this was the tenor of a conversation we just had for 2 hours at my council. We're at the breaking point. We know you are an ally. Can you speak to us to what the future holds, knowing you care more than many of us? You've devoted 30 years of your life to this, but we're at the crossroads in Peel where we need to know there's a path forward that is more equitable. Michael, I want to thank my colleagues. We held off on a motion for 2 weeks that they want to present in 2 weeks' time that I would have to support as well. Can you reach out and tell us and give us a roadmap as to what the next few months and years in your administration might look like? We know we're all on the same side, but we need to know there's going to be a new way of business, doing business going forward. Can you articulate what the future might look like? And so that's why Councillors Santos and Vicente, the idea of let's refine this thing over the 2 weeks, that provides a bit of a window that I can reach out to the minister and say, here's the flavor of we've just gone through for 2 hours. I can't begin to express the angst and the concern. I know we're all on the same side. Minister, can you speak to the subject for us and tell us, with your good efforts, and we know you care as much or more than anybody in the province, what can we do so that we can all do, by the way, as someone who himself is one of our residents, I believe, and has done his good works in Peel for decades, I'd like to give the minister an honest shot to understand our concern, our angst, and maybe, and I think he will be kind and humble enough to give us a response, and then we can deal with the motion in 2 weeks' time. And at least we put them on the podium to give us some direction, hopefully. So that is my list. Councillor Santos, to you, and to Councillor Vicente, who otherwise, let me deal with this first. I think we should move receipt of 7-1 and 7-2, our two deputants, Carrie and David, as moved by Councillor Santos and Vicente. All those in favor? Seeing no one opposed, thank you. With regards to 13-1, Councillor Santos and Councillor Vicente and my colleagues, is it the wish that we're putting it aside for 2 weeks for a little bit more refinement? And also during that interim, if there may be some more conversation with the province and to see if something may come from that before we deal with the motion in 2 weeks' time. Councillor Santos, would that be acceptable?
Yes, absolutely. Thanks.
Thank you. With that, Madam Clerk, I think we're done with the file, having received you. And we need to vote on the referral itself. Very good. Madam Clerk, I turn that over to you.
So this is voting on the referral back to staff to sharpen the motion and return on the 25th of June. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson? Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon? Councillor Dillon? Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor, and I believe I just heard Councillor Dillon say in favor. Councillor Dillon in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries. Thank you.
Thank you all, and thank you again to our delegates. With that, I go to Delegation 7.3, Leanne Bailey, Manager, Anti-Human Trafficking Programs, Elizabeth Fry Society of Peel Halton, and Constable Joy Brown, Community Mobilization Unit, Peel Regional Police. And it is my pleasure to introduce our next delegation, Constable Joy Brown of the Community Mobilization Unit, Peel Region, who is the chair of the Peel Human Trafficking Service Providers Committee, and Leanne Bailey, Manager of Anti-Human Trafficking Programs. They are here today to provide an overview of the Safe House that opened in April 2020 as part of the Peel Anti-Human Sex Trafficking Strategy. Welcome.
Thank you, Mr. Chair. Good morning. My name is Joy Brown. I'm a member of the Peel Regional Police Community Mobilization and chair of the Peel Human Trafficking Service Providers Committee. With me is Leanne Bailey, Manager of Anti-Human Trafficking Programs, and Jody Miller, Managing Director for the Elizabeth Fry Society of Peel Halton. We would like to thank Regional Council for this opportunity to present information on Bonnie McPhee House. Next slide, please. As a committee representing numerous agencies across Peel, we have been working tirelessly since the inception in 2015 to ensure that we have appropriate housing options for sex-trafficked women and girls in our community. Following our delegation to Regional Council in May 2017, we consulted in the creation of the regional strategy released in April 2018. The committee was successful in their submission for housing in May 2019, and the Elizabeth Fry Society of Peel Halton as the lead. Next slide, please. We want to say a huge thanks to Regional Council and to the Region of Peel for listening to and supporting the Peel Human Trafficking Service Providers Committee and the Elizabeth Fry Society of Peel Halton, and for recognizing the importance and working alongside us in addressing human sex trafficking and gaps in services in Peel. I am now going to turn it over to Leanne Bailey, Manager of Anti-Human Trafficking Programs for Elizabeth Fry Society of Peel Halton, to talk about the house. Thank you. Next slide, please.
Thank you, Joy. At the Elizabeth Fry Society, we have provided trauma-informed and gender-responsive programs to self-identifying women and girls since 1973. The agency has been providing residential programming to women in Peel since the early 70s and has been providing dedicated programs and services specific to addressing human sex trafficking since 2011. Our employees are highly qualified and trained in addressing the unique and complex needs of trafficked girls. All programs are gender responsive, trauma-informed, anti-racist, anti-oppressive, barrier-free, culturally appropriate, and provided through a survivor-centered lens and harm reduction philosophy. Next slide, please. Bonnie McPhee House is a safe, secure, and confidential housing to support young women who have or who are experiencing sex trafficking or sexual exploitation. The intentional design focuses on providing a safe space of respite centered on client wellness and was modeled after Canadian best practices in design and optimal occupancy numbers. Trauma-informed staff are available for support on site 24 hours a day, 7 days a week. The length of stay is short-term, up to 6 months. Cycling in and out is part of the process. It takes survivors multiple attempts to successfully exit situations of trafficking. There are 6 beds available, and residents are provided with specialized programming and supports throughout their stay. Currently, we are operating at 50% capacity to align with public health protocols. The house opened in April and has had 4 clients to date. Next slide, please. Survivors must be referred by an approved referral source, be 16 to 24 years of age, be female identifying, be open to harm reduction, have a willingness to develop and work toward their goals, and be willing to follow program expectations. Next slide, please. There are 3 program stages, each with their own focus. During the orientation stage, we focus on physical and psychological safety. During stabilization, we focus on self-maintenance and care. During reintegration, we focus on building skills and developing networks of support. Next slide, please. Programs are offered through staff and outside agency partners, both on-site and off-site, including coordinated care planning and integrated pathways with the hub and transitional house. Residents are provided with a female mobile support caseworker for long-term ongoing case management. Next slide, please. We would like to thank all of the donors who made it possible to create this beautiful space of respite where survivors can feel safe and valued. We would also like to thank Council once again for all your support and for ensuring that survivors of human sex trafficking have appropriate housing options in Peel Region.
Thank you. Is there anything further from our presenters? If not, I have a list of questioners. Councillors Dillon, Medeiros, Downey. Councillor Dillon. Councillor Dillon, perhaps I'll come back to you if you're back on the list. Councillor Medeiros.
My apologies. Seems to be a technical issue. I'm trying to get rid of the hand. My apologies.
Which brings us down to Councillor Downey.
Thank you, through you, Chair. I just my hugest thank you to Joy and Leanne and the entire team at the support table. They've done a tremendous job in not only physically building the house and putting the house together, but programming, management, everything that it's taken to date. So it was great. Although somewhat hampered by COVID, it was great to finally open the doors and have residents in the house. I was able to do a virtual tour of the house a month ago, which was fantastic. And it's beautiful. It's a beautiful setting, as it should be. And just kudos to the rest of my colleagues around the table for supporting this along the way and for doing what needs to be done in our community to address this issue. The team has just worked tirelessly, and I'm not even sure if I'm doing them justice in articulating this, but Joy has led the charge, and EFRI has met the challenge. So just the hugest thank you to all of you, and please take that back to all of your teams and everybody that's working so diligently to bring this into fruition.
Thank you, and Councillor Downey, let me acknowledge the tremendous advocate you've been on this file since day one. Well done to you. With that, I would ask you at the appropriate time to move receipt of the delegations and a 15.1, but I still have Councillor Dillon on the list. Councillor Dillon, did you wish to speak?
No, sorry about that.
Not at all. So with that, I will thank the delegates for their deputation. Madam Clerk, through to you for the receipt.
The receipt of the delegation and report 15.1 moved by Councillor Downey, seconded by Councillor Dillon. Any objections? Hearing none, carries. Thank you.
Thank you all, and thank you for your presentation. All right, that concludes the delegations. It brings us down to item 8, COVID-19 related matters. CAO Polzinelli, perhaps you might give us an introductory comment before we deal with 8, 1, 2, and 3. Nancy?
Thank you, Chair Unica, and good morning to you, Chair Unica, and members of Council. The region is continuing to move forward with recovery planning and will update Council at its June 25th meeting. However, the public environment in which the region does its work has undergone another important shift, and I feel it's important that I share some of the information around that. The 2 weeks since Council last met have been emotional and thought-provoking for the region's staff, for our friends and family, partners in the community, and councillors I've spoken with. The brutal, unnecessary tragedy of George Floyd's violent death sickens and saddens us. Those 8 minutes and 46 seconds of video challenge any sense of complacency regarding anti-Black racism. We may be thousands of miles away in another country, but we ask ourselves, and we have been asking ourselves, what can we do here in our community, in our organization? In this way, the protests represent a tectonic shift in community life across North America and the world. We have, of course, also seen images of police acting with compassion and with professionalism. We've read and heard eloquent and powerful statements. The issues are not new to us. They are being seen in an entirely new light. So I'd like to address this topic today. The region's work regarding anti-Black racism and discrimination must. Let me share a perspective with you. Each year in February, during Black History Month, staff gather in council chambers for a presentation about anti-Black racism and history and heritage of the Black community. It's a full house. Our executive leadership team attends, and the session is open to people from all backgrounds, all races, all colors. But staff who identify as Black, our Black community, make up a large part, if not all, of that audience. In the discussion, we hear from colleagues, people we work with, about how they are monitored by security when they go shopping. We hear real worries about parents regarding their from parents regarding their children interacting with police. The speakers we invite are asked about advice to give their sons, our sons, so they can be safer and not judged when just walking home from school with their friends. They share hurtful and ignorant words that have been directed at them through their life. So the issues we are hearing about on television these past few weeks have been talked about within the walls of our buildings for a long time. And we must do better for our colleagues and all those we serve in Peel. As a start, we must acknowledge the pervasive existence of systemic racism. Those stories of anti-Black racism will be shared and heard more widely. We need to be better ourselves as individuals and public institutions and recognize where biases exist and see the harm it causes. To begin this work, commissioners are establishing town halls to be held over the summer months. These will create a safe space where everyone can ask, talk, make mistakes, and build understanding. Having those open, real, and for some, those uncomfortable conversations is an important step to learning, to growing, and to changing mindsets. This will help inform additional education pieces we'll be sharing with all staff to increase knowledge of anti-Black racism and experiences of other racialized groups. The region is also collecting and reporting demographic data through a workforce census to understand how representative our workforce is of the community we serve. We know we must do better in this regard. This type of data provides a baseline that helps us see potential systemic barriers faced by employees and segments of the population. Of course, as we examine these issues as a society, crisis response continues. So addressing systemic racism must be part of that response to COVID-19. This means measuring how COVID-19 has impacted vulnerable people, the Black community, and other racialized groups. Together with partners in Peel and across Ontario, we need to understand how persistent issues of racism and inequality contribute to differences in health and well-being. With this knowledge, we can strengthen long-term recovery by supporting the good health and well-being among our Black communities and other disadvantaged groups. The Region of Peel Public Health is a leader in the province when it comes to collecting data based on race. We are gathering such data for COVID-19. We will continue to address data gaps that impair our ability to paint a complete picture of the health of our population. This is a time for listening and understanding, but we know action is needed. We will need new vehicles for addressing anti-Black racism and racial discrimination in Peel. We have existing partnerships and collaborations that we will and are building on. The Community Safety and Wellbeing Committee is co-chaired by myself and the Chief of Police and has representation from Brampton, Caledon, and Mississauga Council members. Council has a Diversity, Equity, and Anti-Racism Committee focusing on external community issues, which meets next week. We have the Community Response Table, which was developed during COVID crisis response. It has self-organized into task groups, including one to address systemic discrimination including anti-Black racism. These partnerships are growing stronger as response evolves, and they will take the work here to further improve our recovery phase. At Council's direction, we are ready and we are working to address these issues of systemic discrimination and anti-racism with a human-centered, made-in-Peel approach. The work of recovery and the need for addressing anti-Black racism are linked. The crisis has taught us this. To prevent community transmission, we had to support everyone in the community. The pandemic exposed how our well-being is connected. As a provider of health and social services, the region's human-centered approach also mitigates the potential of other crises to develop in mental health, for instance, or in the management of chronic health conditions. So let me remind Council of some of those examples. Homeless clients needed self-isolation, and they are being supported in a holistic way. They have access to a physician, nurse practitioner, and 24/7 nursing. They are connected to primary care for after isolation, and housing staff are working with them to find long-term stable housing. At Peel Living, we've mobilized volunteers to extend wellness checks and supports to seniors. We've kept moving forward on the region's anti-human sex trafficking strategy, as you heard this morning. Although many staff from PAMA have redeployed, it is providing and continues to provide interactive programming for youth, for parents, seniors, which supports connection and social cohesion. And I'm sure most of you saw the recent Toronto Star article following the Region of Peel registered practical nurse Darrow Hodden. Our long-term care staff have risen to the challenge of COVID while continuing to deliver care and services compassionately. That compassion for frail seniors, the wellness support for the homeless, connection for the isolated were integral to crisis response and saving lives. Lessons from these programs will be part of the region's recovery. An important lesson is that recovery, like response, will achieve better results if we engage everyone in its success. So real change regarding anti-Black racism and systemic discrimination, both morally necessary and socially and economically valuable. We'll need everyone pulling in the same direction, treating with respect and fairness and feeling hopeful about access to opportunity. So we will listen and learn from the voices of our Black colleagues across the organization and those in our community. We will prioritize action over words in our recovery planning, and we will build a successful recovery for a true community for life that is fair, equitable, and supporting the well-being of all. Thank you.
Thank you. Let me just add very briefly, as the regional chair, we have much to do. I think the key is acknowledging that. I've heard it said you can't fix a problem until you acknowledge you have a problem. And I think it starts with that, recognizing that we can do much better. The final thought I have, because we'll all have lots more to say on this going forward, is something our own Juliet Jackson shared with me months ago, and I think it rings true now more than ever. We really do need to have some uncomfortable conversations if we want to make the system better, and it's incumbent upon us that we do. Councillor Downey, I think this might be the perfect time to bring forward the motion that you've penned for us that I know all our council colleagues have received. So why don't I bring that forward now and have you speak at this time, please?
Thank you, through you, Chair, to Nancy. Thank you for your words this morning. I truly appreciate them. I know we've had some conversations over the last few days that were difficult, and I commend you for supporting all of the regional staff and the communities in the way that you have so thoughtfully. Initially, I was unsure of the case mapping with COVID-19, mainly because I was worried about the fallout in high case neighborhoods and further stigma that would be endured by minority communities. But I think that our staff have done a really good job in using COVID as a tool for learning and change, and we can work to dismantle those systems of stigma that benefit non-racialized communities and leave minorities in the dark. We have a lot of work to do, and the work will be difficult and it will be uncomfortable for many of us, but it's time to act. I know that many of you have read the recent reports on the school board, and I've been saying this for quite a few months with some of my colleagues that care to listen. Our school board is on fire. Our communities are on fire. Our Black community is suffering tremendously, and we ultimately have a lot of work to do. The motion is somewhat lengthy, and I apologize for that, but there is a lot that needs to be said. And at this time, I'm just going to keep it brief. I would ask that my colleagues around this table acknowledge their own privilege, their unconscious biases, and commit to using the seats that we have at this table to start the work.
Councillor Downey, thank you. What I'll do at this time to make sure everything's in order, Madam Clerk, this does come to us somewhat late, so we require 2/3 to deal with it first. So if you could first administer that vote, please, so that it's properly before us.
Thank you. Yes, as there was no prior notice of this motion, in order to deal with it today, the rules around notice need to be waived, and that requires a 2/3 vote. So we'll take a 2/3 vote at this point to table the motion from Councillor Downey. Mayor Brown? Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon? Councillor Dillon? Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
Calling Adidas.ca. Please note this call may be quality.
Councillor Innes? Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, I do.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Absolutely.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll just call out again to Councillor Dillon.
Can you hear me now?
Councillor Dillon, yes?
Yes.
Councillor Dillon
Yeah.
in favor. That's unanimous. Thank you.
Okay, so now the matter is officially before us, and I do want to read the motion as moved by Councillor Downey, seconded by Mayor Thompson. Whereas the region of Peel is comprised of diverse communities within the cities of Brampton and Mississauga and the town of Caledon, and whereas approximately 50% of the region of Peel's population identifies themselves as a member of a visible minority group, which is more than 3 times the national average and more than double the Ontario average, and whereas anti-black racism is an historic, pervasive, and systemic issue in our cities, towns, and regions, and whereas anti-black racism is experienced within institutions and contributes to higher rates of precarious employment and unemployment, significant poverty, and overrepresentation in the criminal justice, mental health, and child welfare systems, and whereas the Minister of Education has directed the Peel District School Board to provide to the government a plan to address the findings of the Huggins Report, and whereas visible minorities are disproportionately at risk with respect to income, housing, and other social determinants of health. Therefore, be it resolved that Regional Council recognizes anti-black racism as a crisis within the region of Peel. And further, that Regional Council affirms its commitment to address systemic discrimination by supporting policies and programs that address the inequities that the Black community and other marginalized groups continue to experience within Peel, including but not limited to engaging Black communities to address racial inequities related to the COVID-19, providing funding to mental health housing harm reduction programming to support marginalized groups, including the Black community, through Peel-funded programs, ensuring Black-led serving social agencies in Peel are funded equitably through the regional funding mechanisms, and requesting that the local municipalities collaborate with the region to carry out anti-racism public education. That is the motion before you. My list is Groves, Thompson. Councillor Groves.
Thank you, Chair Anika. This topic is not new. It's been around for years and years and years. The only thing that I've seen, I haven't seen any action, but I've only heard talk. And really, like they said, talk is cheap. And I can tell you, I've had many experiences myself. I can tell you that when I first came to this country in 1979, for 2 years I cried and I wanted to go home. But fortunately, we had a very strong mother who guided us, taught us how to be strong and overcome those challenges. There are many people that are struggling, and unfortunately, they may not have the support at home that they need to get them through those challenges. So it's unfortunate that it had to take the death of one man for people right across this country and the US to recognize that racism hurts. It hurts us all. I had a grade 8 teacher who said, "Oh, you're not going to get too far in life. You're going nowhere." Well, you know what? I had to work extra hard to make sure that I was able to prove her wrong. So I think it's time we all stop talking. Everybody's jumping on the bandwagon now because of this George Floyd, because this innocent man was murdered. So now we're all jumping on the bandwagon. It's been an issue for a long time. And again, it's time that we stop talking and start doing something about it, because there are many people that are not fortunate enough to have the parents that they need or the support at home to get them through these challenges. Thank you.
Thank you. Mayor Thompson.
Thank you. And to follow up with Councillor Grove said, I'm proud to second this motion. And I think we should take this report and use it as an opportunity to make real change in all of our public institutions. It's time to get real about racism. I know this work will be hard and uncomfortable. I know I'm ready, and I know Callan's ready, and I know the region's ready. Thank you.
Thank you. With that, Madam Clerk, I turn to you to administer the vote.
Thank you. For the motion as read, Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
In favor?
Mayor Crombie in favor. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes, in favor.
Councillor Dasco in favor. Councillor Dillon.
In favor.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
In favor.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes. Councillor Innes. Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Absolutely.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor. It's unanimous.
That carries unanimously. Moving on. COVID-19 related items. 8.1 is an update on COVID response in Peel, an oral presentation by Dr. Lawrence Lowe, our Interim Medical Officer of Health. Dr. Lowe.
Thank you, Mr. Chair, and good morning, Council. And thank you for the privilege of having been able to sit and listen to that discussion and the passage of that motion. I would echo what CAO Polsinelli said in her remarks. We do know that racism has no place in our community by no person, and especially we stand with those for whom the last 2 weeks has been particularly difficult and state firmly that there is no place for it. For us, at least in the field of public health, we do know that racial disparities impact health and well-being, and this is why Peel Public Health has identified advancing health equity as one of our 10-year strategic priorities, which were endorsed by Council with our strategic plan late last year. Especially even in respect of COVID-19, we do know that the pandemic, while it does not necessarily discriminate between the victims that it infects, we do know that different communities have had different risks for exposure, and I'll speak to those in the rest of my update, but wanted to make sure that I delivered this important message at the outset. I will begin by, again, as usual, speaking to the ongoing trend of the COVID-19 pandemic in our community. Specific numbers are continuing to be emailed to all of you on a regular basis and available on our dashboard at peelregion.ca/coronavirus. As we move into the provincially announced reopening, the regional approach to phase 2, it's important for me to remind Council of the overall goals of the pandemic response, which we have explored since the beginning of March. The goals were, in starting this journey together, to prevent the loss of life and sickness in our community to the maximum extent possible, to protect the healthcare system, and to minimize the social and economic impacts of COVID-19 on our community. When we first took the steps that we took in March, our intent was to bring what had started to transmit in our community, a novel coronavirus, under control. And 3 months in, things are starting to look up. Lots of people in the community have stated that this has been a long time, and I do know that many in the community are weary. I do know that many sacrifices have been made by community members and by businesses. But this is in essence what we meant by flattening the curve. We dropped the peak in terms of the number of infections and lengthened the tail to spread out the number of infections over a longer period of time. And in thinking of that tail, we are starting to see evidence that we are moving into the tail end of the first wave of COVID-19 in at least Mississauga and Caledon in our region, with Brampton just on the shoulder, which is why recent messaging has focused on getting things fully under control there. Our new cases have started to slow from the initial increase that we saw a week and a half ago, and our 7-day moving average continues to improve. And in thinking of the rest of the enhanced indicators that we're reporting on, we do see our hospital capacity improving. The measures of severity that I've used previously around hospitalizations and deaths continue to decrease across the region. And we also know that our testing and tracing capacity remain at high levels and ready to respond. We also know that the dire circumstances seen by some long-term care homes in our region have now fully resolved, and that most of the long-term care home picture in our region is under control. And as things move back to the community, we are seeing more young cases infected with COVID-19. However, the response has been successful, together in partnership with our hospital and healthcare partners, with your support as Regional Council, and with all of the community in achieving our first 2 goals in averting a significant loss of life and significant sickness, and also in protecting our frontline healthcare workers and first responders and the capacity of our healthcare system. To give an idea of how the response has changed, at the height of the response, we were dealing with nearly 90 to 100 cases a day, which would constitute hundreds of cases, almost 1,000 cases a week, with our contact tracing team still tackling these doggedly. We are now getting to a place where we are able to more quickly narrow down and pinpoint where exposures and outbreaks may be happening within our community, thanks to our redeployed resources and also the slower rise in cases on a day-to-day basis. And so, with the recent provincial announcement around phase 2 reopening, we naturally turn our minds to think about what that will look like. As we move towards a phase 2 reopening, the reduced caseloads and the testing and tracing capacity that we have built means that we can open up more of the community, but we must do so in a cautious and gradual manner. As we open the community as well, it is important that we remind people, our residents, that it is to them to be vigilant and follow the four core behaviors that I have spoken of throughout the past few months. This is why I've welcomed the announced regional approach for phase 2 in Peel, because we are still slightly behind on the wave 1 curve compared to other jurisdictions. We also have many more businesses, venues, places of worship, etc., that need to get ready. And so the delay of phase 2 in the region of Peel gives us time to remind the public and to remind residents of their importance to doing their part in washing their hands, keeping apart, wearing a mask where they cannot do so, and getting tested and staying home if they feel sick. We also know that we will be able to work with many of our workplaces in directing them to provincial guidance to allow them to reopen safely. And speaking as to 2 reopenings that were permitted to begin as of tomorrow, we will be communicating with childcare centers in the region of Peel that they should hold on opening until we are able to deliver and adapt the emergency childcare center protocols for COVID-19 and ensure that those are in place prior to their opening. And also in places of worship, we will be issuing guidance today via letter to all places of worship around how they can operationalize the recent reopening announcement to ensure that their parishioners, their attendees, all the people that may come to the places of worship are able to practice the 4 core behaviors that I've described. And both of these will be communicated. Both of the details of these will be communicated with the relevant parties today. And through the next week, as we continue to monitor reopening indicators, we will continue to target phase 2 businesses that will be reopened in the later phase to ensure that they too can take steps to protect their staff and clients. Finally, I wanted to talk about what Peel Public Health will continue to do as we move towards reopening. The precautions that the public and these reopened venues will be taking are necessary to stop transmission in the first instance. However, as we have done since January, Peel Public Health is ready and has pieces in place to address situations where transmissions and outbreaks might occur. Firstly, in respect of data, we are continuing to publish our monitoring reopening metrics on Friday in the epidemiologic summaries, our weekly epidemiologic summaries. These indicators, as I've mentioned previously, allow us to monitor what areas need attention as we reopen, whether there are concerns around capacity or concerns around changes in the viral picture. But they are not a point or target on their own. Rather, they flag areas of attention that may, in the rest of the context we're looking at, ask for us to identify other interventions or consider rolling back or moving more slowly or cautiously. Those metrics continue to be available on Friday in the weekly epidemiologic report. We also are in the midst of launching our interactive map as promised, which will speak to geographic distribution of neighborhoods which have seen higher incident rates amongst residents with COVID-19. Again, understanding the limitations of the map that I've spoken to in respect of risk, exposure, and transmission, I would like to thank our colleagues in enterprise services, digital information services, and health services outside of public health who have moved with breakneck speed to make this happen. I've seen a pilot of the map, and I think it will be a great addition that will provide another input of data as we reopen our community. And finally, as CEO Polsinelli mentioned, I am pleased to report that we will be able to report on a preliminary sample of cases for which we have collected race-based data, self-identified race data, and that summary will also be released tomorrow in the weekly epidemiologic update. I can also speak to the last pieces around testing and tracing, which we also still have in place. So pop-up testing has started through a mobile mechanism together with our Ontario Health and hospital partners. We were in Gore Meadows yesterday in Brampton, and tomorrow we will be at Malton Community Center. The hours and the exact directions and how to access will be placed on our website if people are interested. Additional testing sites will be released in the weeks to come, and this is all part of a Made in Peel approach that is layered on testing within neighborhoods that have higher incident rates, workplaces that are in outbreak or at risk, and then also occupations that are at risk by virtue of their work, such as first responders. The mobile testing site that we have identified will move through all of those on a regular rotation in the weeks to come to ensure that we are testing widely and staying ahead and identifying other chains of transmission in the community that we may not have picked up through our assessment centers. Our assessment centers do continue as well, and also our ongoing outbreak response team with paramedics and dental hygienists are still available and pursuing various outbreaks and testing in congregate settings as well as in workplaces. And finally, in respect of contact tracing, our contact tracing team continues to meet provincial targets, with 96% of new cases having contact tracing initiated within 24 hours. And as reopening occurs, we actually encourage residents and businesses to also start keeping track of their contacts and interactions, which may help assist us with contact tracing should they fall ill. We know that flares occur with reopening, and this has been seen elsewhere in the world, in Germany and South Korea, that have all gone before us. And it is important that we have that information to assist contact tracing efforts in the event that we do need to look back. In closing, I would like to say that things are very much looking up, but we mustn't become complacent. We must continue to encourage residents to practice the core 4 behaviors, and we must continue to encourage reopening venues and businesses to follow the guidelines to encourage those behaviors. Peel Public Health will continue to release data, test and trace to inform the response, and eventually, together with all of these taken together, I believe we will bring this first wave to an end. Hopefully then the bubble will start to shrink around closures and viruses activities within our community rather than shrinking around our lives. So with that, I would like to thank you for your attention to my update. I'm happy to take your questions at this time.
Thank you, Dr. Lowe. I have a list of speakers. It is Santos, Downey, Dasco, Groves, Demerla, Sato. Councillor Santos.
Thank you, through you, Chair, and thank you, Dr. Lowe, for the amazing work that yourself and your team continue to do throughout this crisis. And I'm very happy to hear more about the contact tracing and tracking, and happy that we have our mobile and pop-up assessment centers in Brampton. But I have a question about the complications and the coordination and communication between municipalities and regions who are nearby that are now entering phase 2 and have hair salons and other places that are open, where, you know, residents in Brampton may go to those neighboring municipalities either to enjoy their parks and wading pools and get their hair done, and then return back to Brampton. Like, are the regions that are in phase 2 and those that are not in phase 2, are we all coordinating properly? Because now more than ever, this is when the contact tracing becomes even more important.
So thank you for the question, Councillor Santos, and through you, Mr. Chair. Yes, I do remain in regular contact with medical officers of health in our neighboring jurisdictions and throughout the province. Certainly the question of interregional travel is something that has come up and is of concern. I would say it is more of concern for the jurisdictions outside of Peel than for those of us in Peel, because there's a recognition that, as I said, we are starting to get into the tail of the first wave here, but we are not out of the first wave like many of the places that are moving to phase 2 are. And the concern in those jurisdictions is that an individual who might travel there, who might have COVID, might import unintentionally the virus into those communities. So I think it really speaks then to, as we reopen, going back to the 4 core principles that I've identified, which is the most important one is if someone feels sick, they should be getting tested and staying home, ideally. And then to the broader extent possible, to minimize risk no matter what people end up doing, they should be trying to maintain their physical distance, they should be practicing hand hygiene, and they should be wearing a non-medical mask. But I would add and underline under all of this, really the goal is to reduce the interactions and close contact that cause the transmission of this virus. So to the extent that people can also limit things, such as non-essential travel, particularly out of the region, I think that will go a long way to ensuring that we are all able together as the Region of Peel and as the province of Ontario to eventually put this virus and this first wave behind us. So to your point, Councillor Santos, through Mr. Chair, I would say to residents who are thinking of traveling out of the region, we're not that far behind. It's not that we're going to be moving to phase 2 at the end of summer or something. It's just a matter of at least holding on, I would say, for the coming week or two. And hopefully if the picture continues to improve here, then we too, while we're doing the same core 4 activities, core 4 behaviors, we too can also enter phase 2 when we are ready.
Okay, thanks, Dr. Lowe. I do worry because as cottage country opens up and some of those regions are waiting for tourists from the GTA to come into their areas, I think that communication to residents about, just because you're leaving the region doesn't mean you have to stop practicing physical distancing and social distancing because you're up north. I think it's super important when everybody's hanging out around the bonfire that they are still cognizant of the fact that that we're still trying to battle this COVID-19. Thanks so much, Doctor.
Thank you, Councillor Downey.
Thank you. Through you, Chair. I think my hand was up inadvertently. But thank you to Dr. Lowe for the presentation and carry on with the good work. I think that we're all feeling length of COVID and really hoping that the opening of our communities, is successful and doesn't, I feel as though it might be a self-fulfilling prophecy into a second wave, but we will carry on.
Councillor Downey, can you speak up, please?
Sorry, can you hear me? Is that better? Yeah, sorry. As I was saying, Karen, I feel as though as we move into opening up our communities, that it may become a self-fulfilling prophecy to a second wave, but that we all carry on and continue to communicate diligence to our residents and safety measures as much as we can. Thank you, Dr. Lowe.
Thank you. Councillor Dasco.
Thank you through the chair, and I always appreciate hearing what Dr. Lowe has to say, some sage advice. I guess two things that are of concern now to me. You had mentioned about starting to get a little bit of a handle, from the sounds of it, on our long-term care homes. However, in Ward 1 in Mississauga, the latest is at Port Credit Residences. We have 19. And there's some concern just in terms of the length of getting everybody else in the facility tested, and just wondering if you have any information on that. That's question number one, and then I have a separate question as well to follow up.
Thank you very much for the question, Councillor Dasco, and through you, Mr. Chair. I wasn't made aware of the situation at Port Credit Residences, and what I can promise is that I will loop back with the team, and I will come back to you with insight as to what is happening in that retirement home community.
Thank you, Dr. Lowe. And then my second is just with regards to getting some messaging out. I think it was alluded to as well, with things starting to open up, people wanting to, I guess, getting almost a little bit of cabin fever and wanting to migrate to different places. A significant situation that keeps bubbling up down on the waterfront area in Mississauga is a lot of folks that are not local want to go out and kind of stretch their legs, if you will. And we're ending up with a lot of folks that are not local down there, a lot of concerns from the locals about transmission and things like that. So I'm just wondering if maybe there's some messaging that we could have out there that would encourage folks to stay local for now. And if they're going to use a park, like I understand Brampton has opened up parks today and things of that nature, that everybody might be encouraged before venturing elsewhere, cottage country, etc., to stay local and while keeping their distance, of course.
Thank you. If I may respond, thank you, Councillor Dasko, for the question through you, Mr. Chair. This is definitely the message that we've been trying to deliver, at least in respect of certainly going out, making sure that that you're not necessarily heading to scenic hotspots that may become viral hotspots. I think the more important thing is that as we do reopen, it is really important, and I think people would do well to be mostly reminded that regardless of where they go, what they do, whether it is to a reopened place of worship, whether it is to their local park, and if they start to try to venture out more locally, as long as they are practicing those core 4 behaviors, those will certainly help to reduce risk. But I agree with you, Councillor Dasko, and certainly the sentiments expressed by Councillor Santos as well. To the extent that we can try to keep people just, we're getting there, and just have people stick to the region as much as we can, probably just for the next week or so while the numbers come in. The hope is that we will be joining other jurisdictions in phase 2 shortly, and that might open up a whole world of other possibilities besides just heading to the lake. Although the lake is nice, so thank you.
It certainly is, but reinforcing folks to stay in their own respective neighborhoods as much as possible would be always welcome. Thank you, Dr. Lowe.
Thank you. Councillor Groves.
Thank you, Mr. Chair. Thank you, Dr. Lowe, for the good work that you continue to do here for us in the Peel region. I just have a couple of questions because I've had these inquiries from some of my businesses here in Bolton. And I didn't see them on the list, so I don't, with the martial arts community, I didn't see them on the list for phase 2, and dance studios. Do you have any comments on that? Do you know if they're going to be allowed, when, or?
So thank you for the question, Councillor Groves. I know that, and through you, Mr. Chair, I know that these are all being discussed at the provincial command table in conjunction with the public health measures table on a regular basis, and I'm in regular contact with the Chief Medical Officer of Health, Dr. David Williams. In respect to those specific business sectors, as well as broader business sectors, I haven't received any further information as to where they are in the considerations, as well as when they may be reopening. I would say, at least at this time, my big focus is certainly making sure that we are ready and prepared to go into phase 2, both on the basis of our picture and the indicators that we continue to monitor, but also just in terms of the broader overall context. I think the one thing we'll also be looking is how does the phase 2 reopening go in the rest of Ontario that will be opening up on Friday, and that will help to sort of inform where things go from there. And I imagine it will also inform the province on additional business sectors that would be considered for either later opening within phase 2 or within phase 3 if and when we do get there.
Okay, thank you, Dr. Lowe, and maybe you can just keep me posted on that, because these folks are very anxious, because as you know, there's a lot of revenues that they are losing. They continue to pay rent, and with no revenues coming in. So if you don't mind just keeping me posted so I can keep them in the loop, because they're just at a loss right now. Thank you.
So if I may respond through the chair to Councillor Groves, I'm happy to keep you posted, and certainly happy to also discuss. If they have any questions, they can also contact our info line at 905-799-7700 to talk a little bit about reasons why they may be being opened later. I think a lot of it has to do with the nature of the engagement and the business that they run, just in terms of thinking about contact and interactions and the ability to do so safely. So I'm certainly happy to keep you apprised.
Okay, thank you.
Thank you. Councillor Demerla. Councillor Demerla.
Yes. Thanks, Chair. Dr. Lowe, nice to see you again. My understanding is that the entire GTHA is delaying phase 2, not just the region of Peel. So you really can't go to Vaughan and get your hair cut or anything like that, right? So I just want to make sure that that's how I understand it. And then the second one is a little unclear to me, is the houses of worship, because what I thought was the rule around all 10 people, like more groups groups of 10 and houses of worship was province-wide. And I just want to confirm that because I thought I heard you say something about one maybe delaying the childcare centers, but then I heard you say something about reaching out to faith groups about making sure they're ready. So just want to make sure that they still get to open on June 12th, what the story is.
So thank you, Councillor Demerla, for the question, and through you, Mr. Chair. So I'll answer the second question first, which is, as I understand it, with the recent announcement, houses of worship are being opened province-wide as of 12:01, and our team is working to get guidance out that will assist them to open safely in helping their staff and those that may attend at a house of worship to be able to practice those behaviors, the 4 core behaviors that will keep them safe and reduce risk of transmission. So that was what I said in respect of places of worship. I understand with childcare centers, the announcement that was made on Tuesday was that those would open those would be permitted to open dependent upon the perspective of the local medical officer of health. And so that is why we are, at least to the Region of Peel, going to be issuing advice to those childcare centers to not open as of Friday until we are able to bring them specific guidance. We have over 150 childcare facilities in the Region of Peel, and we want to make sure that there's guidance that has been got out to them, adapted from the emergency childcare guidance that we had when those opened in March, to ensure that they are able to open safely with COVID protocols and procedures in place. And then through you again, Mr. Chair, to your first question, Councillor Demerla, it is at this time, it is the Greater Toronto and Hamilton area that is it is remaining in phase 1 for now. However, as I understand it, there will be ongoing conversations with each of the health units with the province, and the province will then identify how they wish to proceed. So it may very well be that they will shrink the extent of places that are left in phase 1 or expand it further, whatever the case may be. But either way, the decisions are being taken at the provincial level, but I will be given, together with other medical officers of health and our health units throughout the province, the opportunity to advise how we feel our health unit would be, so that they can figure out what the aspects of the regional approach might look like going forward.
Thank you. That was
Thank you. Councillor Sato.
Yes, thank you, Mr. Chair. Thank you, Dr. Lowe. Always good information from you. I have a question with regard to the mandatory masks. As you know, we have, you knew this question was going to come. As you know, we are mandating masks on Mississauga Transit, and I understand Brampton is doing the same, and Hamilton has, and I think Toronto just announced that they're going to as well. But as you're aware, Wellington, Dufferin, Guelph, medical officers of health have put forward an order just, I think, 1 or 2 days ago that masks will be mandatory in all of the commercial establishments that have now been allowed to open in phase 2. And I've been asked by my residents, will the Region of Peel be mandating the same thing? So while I think the mandating of masks, I like the idea quite personally, but it would be, I think it would be less confusing if it was a provincial order. But if it is not going to be a provincial order, do you have plans to follow what the other, because I expect there will be other medical officers of health that will, those that are now opening in phase 2, that will be issuing the same order. So do you have plans for that as well?
So thank you for the question, Councillor Sato, and through you, Mr. Chair. I can actually speak to the overall concept of mandatory masks, and I know that I've been in conversations with municipal bylaw enforcement and other health units as well. At this point in time, we still continue to strongly recommend the use of masks in areas where you cannot physically distance. Certainly the evidence around universal mask usage or the mandate of masks is limited, and it's mostly been limited to observational studies from other countries where the use of masks is more widespread. But I think further to the issue, At this time, I don't currently support the mandate or mandating the wearing of masks for the sole reason, for several reasons, rather. One reason is simply the difficulty with enforcement. It would essentially be on a complaint basis. It would be, as I was saying, as I spoke with one of our directors of bylaw enforcement, it would be essentially unenforceable because if people would complain, they would send out a bylaw enforcement officer, the person would take off. And I think there would be challenges in that regard. I think the other challenge that we would have with mandatory masks is that there's an equity issue as well. So we do know that there are many people who haven't been able to procure masks. I myself ordered masks and just managed to get them after 6 weeks. And so it may limit things. We also know that there are certain racialized minorities who may not choose to wear masks in public for many other reasons. And I think the final thing about mandating masks as well is that mandating masks goes another step further and may cause certain segments of the population to then reject them just by virtue of the stronger measure that has been taken, as opposed to standing pat with a strong recommendation. So there are lots of pros and cons to both sides. I think at this time, with the strong recommendation, we have seen significant uptake of masks. I do a quick sort of anecdotal look at when I'm in grocery stores. I think the mandating of masks on public transport, certainly with the increasing period and the clearer evidence that we have of transmission on public transport settings from other countries, is where we went with that one. But I think I would likely be more in favor of mandatory mask regulations if and in such time, for example, we're in a second wave where there is clearly continued noncompliance or significant noncompliance with the recommendation, and also a significant need at that time, as opposed to where we are in the curve and the potential responses that might arise from the community as a result. So it's something that we're studying very carefully. And I will also mention as well that in addition to Wellington Dufferin going forward with it, I'm not currently aware of any other medical officer of health that is considering taking the same step with a Class 22 order. They may be, but I certainly haven't seen that publicly. But I do know that it is being also carefully considered at the provincial level as well, and that may also be something that comes down. So I hope that answers that. Okay. I guess that. Whoops. Sorry, I'm really echoing back here. The comments that I guess I've been seeing on mainly on social media, but also from emails, is in regard to people complaining when they go into a store and the employees are not wearing masks. They really like the stores that are requiring masks because they feel safer. I went into a store. I haven't done much shopping. I send my husband for curbside, but I did go into a small store that I knew wouldn't be busy. I think I was the only customer in there at the time the other day. And I was sort of, it was kind of funny in a way. I was wearing my mask, but none of the employees were wearing masks, and they were walking around the store. And then when I went to check out, the employee who had been walking around the store with no mask went and stood behind the plexiglass screen at the cash register, and everything was handled there. And, I tapped, didn't want to touch anything or anything. And I thought, yeah, you've just walked around the store, came over and spoke to me at one point, and then you go behind the screen. I don't think people quite understand the whole concept of spread. So, I know I've been asked by some of the businesses that are looking forward to opening again, that they are really asking for a lot more access to advice as to how they can open their business. I had a call from Erin Mills Town Center, very large mall, and they said, like, where can we get the best advice so that when we open again, we will be ready with all of the protocols and all of the precautions in place. And they were told, I put them in touch with our economic development staff to direct them, send them in the right direction, because it's very specific information that they're asking for. But, they want to do the right thing. I think especially the larger businesses. So I think it will be confusing if others do mandate it and we don't. And I guess we have to wait and see that. But
If Halton decides to do it, it's going to be very difficult for us not to, or if Hamilton decides, for example.
If I may, thank you, Councillor Sato, and through you, Mr. Chair. Absolutely agree, and I think this is why I'm in constant contact with our other medical officer health colleagues to ensure that we are coordinated in the advice and the recommendations that we are giving. I think to your experience, I would mention that as long as the employees were also still maintaining physical distancing, because we know that masks are really just one part of it, and maybe not. But I think the more important point that I would make is that it still is a very strong recommendation that if you are in a setting that you cannot mask, that you cannot distance, that you consider wearing a mask. And I think the businesses that have taken that recommendation seriously and chosen to implement it in their operational plans clearly understand the nature of the recommendation and the intent behind it. I think the only other thing that I would add is for any business that is looking to reopen, there is provincial guidance that is available online, and they can look up COVID-19 workplace. That's the best place to start. But in general, they should be thinking about the best ways, whether it is if it's tight space and they can't distance, whether it's making sure that their employees are wearing a mask, to really get to those 4 core behaviors, right? And so hand washing, distancing, masking, and making sure that people who are sick are not attending a premise. I think as long as they can think about how they structure their work to make sure that happens and their processes, and they can rely on the provincial guidance as well, then masks will be a part of that, and hopefully many other pieces will ensure that their staff and their clients are kept safe.
Thank you.
Thank you. Mayor Crombie.
Thank you, Mr. Chair. And yes, I'm here. I hope you can hear me. I actually emailed the wrong email to get on the list, but that's okay. First, Dr. Lowe, thank you for your guidance. I'm very pleased about the regional approach, and I thank you for having your input. And also, I guess the decision will be made by Monday that we can reopen next Friday, which is the 19th. And you know now that you will recommend, if you had to make that decision today, it's still a few days off, will you be recommending we Peel move into phase 2?
Through you, Mr. Chair, thank you, Madam Mayor, for the question. I can say that I would certainly look very closely, just given the numbers we've had this week. As you all know, I'm following our 7-day moving average in addition to the capacity as well as the broader context in which we're operating. Certainly the possibility for extra regional travel as identified by Councillor Santos and Councillor Dasco is of concern to me. And I think also the capacity we do have seems to be meeting the immediate need in the response, as well as the 7-day moving average seems to be starting to trend downwards. So I would say I would likely be in a position to possibly recommend for next Friday, if not certainly at least in the coming couple of weeks. I would feel I would feel much more confident recommending at least in the next couple of weeks, provided the picture that we have right now continues to stay the same or improve.
So the Premier has taken the position that the GTHA and the Golden Horseshoe really is where the density is and the majority of the COVID cases exist. So is there a possibility they would carve out different areas and there could be more of an asymmetrical approach? For instance, maybe Toronto was ready and Peel wasn't. What if Mississauga is ready but Brampton's not?
So thank you, Madam Mayor. Unfortunately, I would be speculating as much as anyone else at this table as to how the province would do that, but I know they would look at the input from all of the various medical officers of health around the regions that remain in stage 1, as well as other considerations like things like historical travel patterns, employment connections, all those other things in making their determination.
Okay, I'd be surprised if we didn't open next week, but just 2 other things, because I know everyone's got a lot of questions for you. You didn't mention the LTCs, which I think are all stable and all out of the red zone now. And secondly, it's worthwhile to mention that the demographic has shifted as well. It is a much younger population that is being infected with COVID, if you wanted to reference either of that. And then is there a specific strategy on testing for all the frontline workers? Like how long will that all take and how are we rolling that out exactly? So that's just my last 2 questions to you.
Yes, thank you, Madam Mayor, and thank you, through you, Mr. Chair. Thanks again, Madam Mayor, for actually sharing the good news around long-term care facilities. So while I do work to get Councillor Dasko the information on the retirement home in his ward, that is a good point that all of our long-term care homes are now officially out of the red, and many of them are out of outbreak, which is part of the remarks that I made around stabilizing. We are certainly seeing many more young individuals that are testing positive for COVID. And while they fortunately don't necessarily always have the more severe outcomes that are seen amongst the more vulnerable segments of our population, like the elderly and those with medical conditions, we do know that some do have severe outcomes. I think a lot of it is being driven by a number of factors. Certainly, this is the working age population, so many of them may have returned to work in the last little while, may not be following or may not have the opportunity or be afforded the opportunity to follow the protocols, which really speaks to the need for individuals to take the core 4 behaviors seriously, and for businesses and proprietors to put measures in place to protect their workers and those that are there. We do know as well that many individuals in that age group may also be flouting some of the restrictions and some of the recommendations. And I think it's really important to mention that while they do so, they may be increasing the risk of transmission, and they may yet have a rare and severe outcome, and they may also transmit it to someone who would certainly have one. So I think there's certainly something to be said about that. And to the extent that we still get new cases in the region of Peel, that's also part of the reason why we're not entering phase 2 at this point in time, which I think I would drive home to lots of young people who probably want to get back to some semblance of a new normal going forward. And then I think in respect of your second question, and I apologize, Madam Mayor, if you could remind me, because I've been opining on 20.
The rollout to the testing of the essential workers?
So yes, thank you for the reminder, Madam Mayor, and through you, Mr. Chair. As I mentioned, our testing, our community outreach strategy for testing is layered, and so we are focusing on neighborhoods where there have been higher incident rates of COVID-19. We are focusing on workplaces that are in outbreak or at risk, and then we are also working on the first responders and other high-risk occupations. And so those aspects of the strategy are constantly being worked out and will be announced on a bi-weekly basis as to who's going to be tested when on which day. So
will the mobile units be going to them, or will they be? Okay.
That's correct. Yes, Madam Mayor, through you, Mr. Chair, that will be handled by the mobile units, as well as some may be directed to assessment centers, depending on the nature of the testing that is required.
Thank you. Councillor Kovac.
Thank you, Mr. Chair, and through you, and thank you very much, Dr. Lowe, for your guidance to date. Obviously, I understand, I think I'm the last one speaking, so I'll keep my remarks pretty brief, and I think that you had covered this earlier when talking about the importance of physical distancing, but there's some confusion that I find that residents in my area are expressing through email, through phone call. They're seeing the protests. I myself am being invited to events. Lately, a long-term care center, we had a parade, so it was held outdoors. People were not really able to physical distance, but they were wearing the PPE, the facial masks. So this confusion over whether if you're wearing the mask, are you then okay to not physically distance? And then in turn, similarly, if you are, physical distancing, do you not need to wear the mask? Do you have any sort of comments on that? How might I best clear that up, clear some of the confusion that some of my residents do have?
Thanks so much, Councillor Kovac, for the question through you, Mr. Chair. It really speaks to the need for clarity, and I think I used the analogy at my press availability with Mayor Crombie yesterday that it's like driving in a snowstorm, and so you actually need to try to do all of it as best as you can. So you stay 2 car lengths apart from the car in front of you, you keep your windshield clean, and you also wear a seatbelt. So that's basically like your physical distance, your hand washing, and your mask, right? So those are, I think, all of the pieces are needed to ensure that you're as safe as possible. Now, certainly, one of those pieces, in and of themselves, will provide some measure of safety. In the case of masks, protecting others from yourself, right? It's basically source control. But So one of them on their own helps to reduce risk, but the ideal is that people remember that as we move forward in reopening or whatever they choose to do, whether it's a parade, a protest, attending, a service at a place of worship, attending a retail shop, we need everyone to be doing as much of all of those things as imperfectly as possible to really make sure that we put COVID-19 behind us. So just like driving, you can wear a seatbelt, which is like putting a mask on. But if you're driving like a maniac and not keeping your windshield clean, then you're still going to be at a certain level of risk as well.
Thank you for your response.
Thank you. And Councillor Groves. Councillor Groves? I have.
Sorry, Mr. Chair. Sorry, I forgot to take my hand down. Thank you.
Okay, thank you. With that, that concludes my questioners in the presentation. Thank you. That brings us on to item 8.2, update and management of the financial impact of COVID-19, a presentation from Norm Lum, Director, Business and Financial Planning.
Thank you. Good afternoon, Chair, members of Regional Council. The situation with COVID-19 has continued to evolve and change since my presentation on the financial impact on COVID-19 on May 14th. Today, I will provide an update on the financial impact based on what's happened over the last month. Next slide, please. From an economic lens, the labor market has continued to deteriorate. Peel's 3-month average unemployment rate jumped to 13.3% in May 2020. The highest rate recorded since Peel-specific monthly data became available in 2006. Peel's youth unemployment rate more than doubled from 14.2% in May 2019 to 30.8% in May 2020. The rate for adults increased from 6% to 10.7% respectively over the same period. What does this mean in terms of jobs? 50,500 residents left the labor market by the end of April. And by the end of May, this number had increased by 14,200 to 64,700 residents. 20,000 manufacturing jobs were lost by April, increasing to 26,000 by May. Accommodation and food services saw a loss of over 20,000 jobs by April, increasing to 30,500 jobs lost by May. However, on May 19th, the province launched phase 1 of reopening the economy, allowing retail stores and seasonal businesses to reopen, lifting limits on construction with some health and medical services resuming. And on June 8th, phase 2 of reopening was announced by the province. And because of Council's advocacy, the province has implemented a regional approach to the reopening. Next slide, please. Similar to the labor market, the picture for development charges has not improved since last month. On May 14th, staff had estimated that there would be a shortfall of $400 million in development charge revenue over the next 2 years. Based on the latest trends and modeling, a $700 million shortfall is anticipated in the period from 2020 to 2024. This revenue shortfall puts significant pressure on Peel's overall cash flow and financial flexibility. To respond to this increased pressure, the Capital Construction Task Force is reviewing and prioritizing capital projects with specific focus on development charge-funded projects to align the spending with the projected revenue. And on July 9th, staff will report to Council with a proposed strategy to manage the cash flow risks. Over the next few slides, I will be providing an update on Peel's 2020 operations. Next slide, please. So while the costs related to Peel's frontline response have continued to be incurred, we're seeing fewer spikes in costs and a general trend towards lower costs. Losses in user fee revenues continue to be relatively minor, as user fee revenues represent only 6% of Peel's overall budgeted revenue. User fee losses are still being forecast for Transhelp and waste management, where fees were temporarily suspended. In my last update, we estimated that the community housing sector will require $10 million to offset rental revenue loss due to COVID. This estimate has been updated to a figure of up to $7 million. A report on the impact of COVID on the community housing sector will be provided to Council on June 25th. For childcare, the province had directed the provision of childcare spaces to frontline healthcare workers. To date, no confirmation in writing has been received from the province that these additional costs will be funded, leaving an exposure of what was, up until yesterday, $6.8 million. With the province now having announced that childcare can reopen, this exposure will decrease. Overall, the operating deficit driven by COVID is forecast to be $38.7 million, $24.3 million for tax-supported programs, and $14.4 million for utility rate-supported programs. This updated deficit is lower than the $47.1 million deficit estimated in May. This cost estimate does not reflect any costs associated with the recovery efforts, costs such as plexiglass and other safeguards, as we don't know at this point when the costs will be incurred. The projected deficit will continue to evolve and change as the situation with COVID-19 evolves and changes. A key factor in the deficit will be the amount of program funding ultimately received from the province to help offset the incremental COVID costs. Next slide, please. A key contributor to the lower current forecasted deficit is the increase in costs avoided of $8.3 million in the TransHelp service. TransHelp is forecasting a 47% decrease in lower trip demand for 2020. Costs are also being constrained by redeploying existing staff instead of hiring additional staff to fill needed roles such as staff for screening or to manage inventory for long-term care. Savings in discretionary spending continue from not attending conferences, training, and not filling vacancies. While vacancies will be filled when services move towards being fully open again, some vacancies will remain unfilled as staff assess the impacts on service delivery models. In the interim, a priority will be to continue looking for opportunities to mitigate expenditures using lean and other approaches. Next slide, please. As presented to Council on May 14th, Peel had received almost $12 million to support its most vulnerable residents, $5.85 million from the Federal Reaching Home Program, and $6 million from the Provincial Social Services Relief Fund. To date, $1,565,050 has been allocated to 43 community organizations, with 37% of the funding to organizations in the city of Brampton, 6% in the town of Caledon, and 57% in the city of Mississauga. In addition, $5.8 million has also been allocated to the region's homelessness response. Something I forgot to include in my updated slide was the funding announced by Councillor Fonseca on May 14th, which is on as a communication item on today's agenda. The Region of Peel has received $98,000 from the Canadian Medical Association Foundation to support the vulnerable during COVID. This funding will be used to support Peel's homelessness response. And since my last update in May, I apologize, I lost my slide there for a second. No, yes, since my last update in May, long-term care had received up to about $0.1 million and has now received a total of $1.2 million. I apologize for a second, I just lost my place. Last week, Peel paramedics received a letter notifying us that there was a total of $77 million to be distributed throughout the province. An approach to the distribution was still being developed. Finally, on June 1st, the federal government announced that it would be advancing the 2020 and 2021 federal gas tax payments earlier to municipalities in June 2020 instead of July and November. And while the funding is being received earlier, there is no net new funding. Next slide, please. So to summarize, the forecasted deficit driven by COVID-19 is $38.7 million. The priority is to continue to find ways to manage expenditures and lower the deficit. The Capital Construction Task Force will be reporting to Council in July with a proposed strategy to manage the risk to Peel's overall cash flows and financial flexibility. Advocacy for appropriate funding from upper levels of government will be critical to support Peel's long-term financial health. Next slide, please. So as part of the advocacy effort, Peel is collaborating with other municipalities in the GTHA by sharing data and analysis on the financial impacts of COVID-19. That information gathering is being led by the City of Toronto, which has consolidated the many perspectives into advocacy efforts for policies to address the short-term, medium-term, and long-term impacts of COVID. Short-term positions include securing additional funding to address the incremental costs and decreased revenue, additional staffing to support permanent improvements for infection control in long-term care homes, and infrastructure funding to stimulate the economy. Medium-term positions include a review of the provincial municipal responsibilities in Ontario with a goal to remove income tax redistribution programs from the property tax base. This would include programs such as affordable housing, homelessness, and employment support. And lastly, long-term positions include municipalities sharing in Canada's economic growth and prosperity and having access to increased revenue tools. Thank you. That concludes my presentation. I'd be happy to answer any questions.
Thank you, Norman, and seeing none, I will thank you for your presentation. That brings me to item 8.3, advocating to strengthen long-term care and senior services in Peel, a report presented by Kathy Granger. Kathy?
Thank you. Thank you. Good afternoon, Chair and members of Council. I'm happy to be here today to share how we are delivering on our senior services mandate of improving the quality of life for our seniors living in the community and those living in our regional long-term care homes, and how we are performing in accordance with provincial standards and regulations governing our sector. I will also share how the region continues to advocate for this vulnerable sector. Next slide, please. June is Seniors Month, and before COVID, we had planned to bring some of our Peel Manor seniors to celebrate with you. And instead, here we are today, and we're bringing to you a video. Due to some technical issues, you may not hear all the music in the video. There is no talking during the video. So you can try to turn your volume up a little bit higher. Alternatively, a version will be sent out via the region's Twitter account this afternoon. If you'd like to get the full version and the experience. We hope, though, in this video that you see the work that our staff do in our homes to support seniors both in ADS and long-term care, and the love and caring that they provide in order to create a full home for our seniors. Can you please play the video? Thank you. In 2019, 435 of our seniors participated in our Adult Day Services programs. Through annual satisfaction surveys, 97% of the people who participated in this program said that it helped them achieve, maintain, or improve their well-being. And 93% of those who participated in these services and their caregivers said that the program contributed to their ability to continue to live at home. 59% of those in our adult day services were medically diagnosed with a cognitive impairment, including dementia. In 2019, 936 people received care across all 5 of our region's long-term care homes. Through annual satisfaction surveys, 84% reported that they would recommend their home to others as a place to live. The vast majority of Peel long-term care residents have complex medical needs requiring an intensive level of supports. The age of people living in our long-term care centers is getting older. Median age now is 85 years old. 83% of those living in our centers have a cognitive impairment, including dementia, and 88% are extensively or totally dependent on staff. These trends continue to grow in complexity as there are a number of high-need seniors also living in the surrounding community and waiting beds. Next slide, please. In early March, Peel Long-Term Care Centers resought accreditation and received the 3-year Commission accreditation of Rehabilitation Facilities, CARF, through to May 31st, 2023. This achievement is an indication of our long-term care centers' dedication and commitment to improving the quality of life for seniors. The region's long-term care homes also continue to exceed provincial averages for performance indicators for quality care on all of the indicators in front of you on the slide. Next slide, please. The Ministry of Long-Term Care continues to conduct unannounced inspections in every long-term care center across the province. Inspections include interviews with residents, family members, and staff, as well as direct observations of how care is being delivered, and they also review our records. In 2019, we had 32 non-compliance inspection findings, which range from policies to staff training. We also had 3 orders across our 5 long-term care centers, including 1 order of prevention of abuse and neglect related to an assault between 2 residents and 2 orders on continence and bowel management. Peel Long-Term Care Centers take action to address any non-compliance findings to ensure compliance with the Long-Term Care Homes Act through policy revisions, developing new processes and tools, enhancing training, and reinforcing roles and responsibilities of the interdisciplinary team. Next slide, please. With support of staff across the region, back office and frontline quality improvement efforts have continued and expanded. New strategies were designed to support our COVID response. Regional homes reacted quickly to increase staffing, create isolation units, improve infection prevention and control, and enhance continuous communication with families and staff. The region also asked staff to choose to work at only 1 location prior to the emergency order for long-term staff to limit work locations. To address increased staffing needs, we also hired and redeployed over 150 staff, including and not including adult day services staff who were also redeployed into our homes at the start of the pandemic. We were also fortunate to be able to transform our adult day services spaces into supportive care units, which helped us cohort and isolate positive residents. This assisted us with containing the spread of the virus in the homes. The majority of staff working in these temporary isolation housing were LTC staff working in these units. As residents are starting to recover in our homes, these units are now being demobilized. The Long-Term Care Division also has continuously been reviewing any new provincial directives and public health guidelines to ensure necessary information and training is disseminated to frontline staff at regional long-term care homes to support processes, including effective use and stewardship of personal protective equipment. And while visitors have been restricted into our homes, social connections have continued. They've been maintained through virtual visits, reconfigured iPads and window visits, as well as weekly virtual town halls, and a long-term care family support team who provides timely responses to emails and phone calls. Most recently, the region has been asked to support Trillium Health Partners with the long-term care oversight and planning at Camilla Care Community in Mississauga. Next slide, please. The region continues to advocate on investments and strategic direction for long-term care. This includes funding to support the structural and physical remodeling of homes. This is particularly important to older homes like our Peel Manor to allow safe and responsive care. We also advocate for funding to meet community needs and client complexity. For example, current funding formulas do not account for the high growth and high demand communities like Peel, resulting in unmet seniors' needs and long wait lists. Supporting the broader mental health needs in seniors, since there are an increasing proportion of long-term care residents experiencing a range of mental health illnesses such as anxiety and bipolar disorders. And lastly, we continue to advocate for the unique and unmet demands like specialized dementia supports and person-centered care. The region will continue to work with sector partners and provincial government to strengthen long-term care sector and for all seniors who live in Peel. Next slide, please. As the province embarks on a new and important review of the system, we are undertaking immediate action. We have prepared a letter from the regional chair to the provincial government and the Ministry of Long-Term Care to advocate for enhancements to the long-term care sector, highlighting specific priority areas for immediate action and longer-term innovations in Peel. We continue to look for opportunities to participate in the province's independent commission into Ontario's long-term care system beginning in July 2020. The region also continues to work closely with AMO and Advantage Ontario, as well as engaging with ministries of long-term care, seniors, and health to provide advice to the provincial government on improving quality of care, models of care, and rebuilding infrastructure. These collaborations will support sector transformation and collective sector response. Working with all levels of government to ensure strong governance, accountability, and funding to address immediate and urgent needs and build a sustainable, transformed system that provides high-quality, person-centered care is at the top of our advocacy list. Next slide, please. Thank you for your time today. Peel Long-Term Care Centers have one goal and a shared commitment: to contribute to our community for life by providing compassionate, loving, and respectful care to individuals and their caregivers in their time of need. I'm happy to answer any questions. Thank you.
Thank you. My list is Demerla Kovac. Councillor Demerla.
Thank you, Chair, and thank you, Kathy, for this update. Loved the video, even though there was no music. Like that shot of them fishing. I thought that was great. It was quite positive to see how the indicators, how much better the municipal homes are doing when it comes to the indicators. I don't know if it's municipal homes, but at least the region of Peel's municipal homes compared to the provincial average. So that's great. I really like what you guys are doing in terms of the advocacy. I like the emphasis on sector transformation, and I just want to say, just putting more money won't be enough. We really need to transform the sector, and I think it was Kathy or maybe it was Nancy who talked about it a couple of meetings ago, where we said, you know, we've moved away from the person-centered care generally towards a task-oriented way of looking after our seniors, and we really need to focus on moving to the person-centered care so that it doesn't become a series of brush teeth, brush hair type thing, but really, you know, it's about the person and not just the tasks. And the other sleeper issue, and I hope you'll be able to advocate for that as well, is sustainable funding. I was just reading a report on long-term care that says that even at current levels of funding, given the aging population in Ontario, we can see a tripling of the funding requirement at current levels of funding without even adding extra resources, which we know we need to do. So we really have to look at how do we fund this. So some really good stuff. Chair, I just wanted to say that, a couple of weeks ago, I'd raised the issue of the region of Peel, you looking for every opportunity to advocate not only with the province for more resources, but also to talk about the best practices given our better outcomes. And I do see that in the next steps, they have been highlighted, and I really like that. What I wanted to know was, can some of that be moved into the recommendation? And I'm happy to move this, especially looking for opportunities to participate in the province's independent commission into the Ontario's long-term care sector beginning in July 2020. And so I think that's really important, because I think in the recommendation up top, we just talk about a letter, but perhaps we can strengthen that. But overall, just great, and I'm happy to move the report and the recommendation.
Thank you. Councillor Downey.
Thank you, through you, Chair. Thank you for the presentation, Kathy. I just wanted to just highlight some of the conversation around advocacy and how we're moving forward with the province. Councillor Groves mentioned it earlier in her comments regarding anti-Black racism and the issues had been prevalent for some time. These issues are not new, and I think that it's incumbent upon us to look at the issues that we have, and some of them in long-term care as well, recognizing that they're not new, but COVID has put a spotlight on them. And so, when issues have been within our systems and are there, the province is now listening. Our other levels of government are now listening. So we can't, we can see that these issues have been there the entire time. Now people are listening. So we can't always control when people are bring their attention to things, but the attention is there now. So now it's time for us to act on those items. And I think that we have a really good foundation with our team in long-term care, and moving forward, we'll see some really good change.
Thank you.
Thank you. With that, it's been moved by Councillor DeMerle. I think the clerk's made a note of the nature of the language accordingly. Madam Clerk, I throw it back to you.
Thank you. That the regional chair write a letter on behalf of regional council to the Minister of Long-Term Care to convey regional council's support of the province's commitment to complete an independent commission into Ontario's long-term care system to identify improvements that better protect residents and staff across the long-term care sector, including enhanced requirements for appropriate staffing models, emotionally focused patient-centered care, and increased funding. And further, that copies of the letter be forwarded to Peel area MPs, MPPs, Advantage Ontario, and the Minister of Health. Moved by Councillor DeMerle, seconded by Councillor Kovac. We'll call the vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor DeMerle.
Yes.
Councillor DeMerle in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
In favor.
Councillor Fortini in favor. Councillor Groves.
In favor.
Councillor Groves in favor. Councillor Innes. Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Here's another one.
Councillor McFadden. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr? Councillor Starr? Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll just circle back.
Sorry,
Councillor
Catherine, it's Councillor Dillon in favor. Sorry about that.
Councillor Dillon in favor. Thank you. Councillor McFadden? Councillor Starr? Okay, it carries. Thank you.
Thank you. Brings us to 8.4, a report from the clerk regarding regional council meeting schedule during the COVID-19 pandemic, as was requested at the May 28th, 2020 meeting. Madam Clerk.
Thank you. This report is just in response to a request at the last meeting for extra meetings to be added to the summer beyond our usual schedule. So it's proposed that 2 meetings be scheduled, one for July 23rd and the second for August 13th. These meetings would be regular meetings of council, which means that they would have items related to COVID and also non-COVID related items. However, if it is recommended that if the emergency is terminated, that these meetings would be canceled in the usual course of scheduling meetings for regional council. I also note that pursuant to the procedure bylaw, the regional chair is able to call any meeting at any time on proper notice, which he would do if any issues came up of an urgent nature.
Thank you. Questions to that, Councillor Demerla?
Thank you, Chair. I'm supportive of everything. I just had one question. Would it be okay if we moved the scheduled August 13th meeting to August 6th? I guess that would be the Thursday. I'm looking at my calendar because I think we have one on July 23rd. And then 2 weeks later would be August 6th. I'm just saying that, and we can always call, I guess, an extra meeting if we need to, but I just thought that that would align well with the city of Mississauga and probably Brampton and Caledon, our schedules for our last meetings in August. And we've all been working hard and we'll continue to work hard, of course, but it may be nice to just have them all finish in that same week. So just a thought.
Thank you. We did propose the 13th to avoid being close to the August long weekend as well. And Caledon does have a meeting on August 11th. I do recognize Mississauga's last meeting is August 5th for the month of August, and Brampton's is also on August 5th.
So would August 6th work? And I don't know if, how my colleagues feel, but then that way, just frees up the rest of August.
I'm at the discretion of council. If August 6th is preferred, we can put August 6th and we can have the vote, and we'll see if council prefers August 6th to August 13th.
Madam Clerk, why don't I make this a little easier? Assuming none of my speakers are on that subject, why don't we just put it to a vote right now that my colleagues, do you prefer the 6th or the 13th? Why don't I accept that Councillor Deepika Demerla has moved that it should be the 6th? Why don't we call the vote on the 6th? I will remind you, it's my recollection always that into the summer months, we always tried to tidy it up by the first week of the summer month. So, Councillor Demerla, your request is not an unusual one. And of course, in as chair, if something were to happen, I'd immediately call a meeting if I thought it was necessary. So why don't we just deal with that informally, but through a vote through the clerk, that what does everybody feel about the 6th for the August meeting? Madam Clerk, if you could call that.
So this would be the vote on the whole motion. Did you want to finish the speakers first?
And why don't we finish the speakers, and that way we'll deal with it all at once. So, Councillor Demerla, if you had nothing further on the other aspect of the conversation, I will carry on with my list. Councillor Downey.
And my
I think my
apologies.
shaking will go there.
My hand was up.
But there's
Sorry, Councillor Downey, were you saying you had nothing at this time? Okay, that's what I believe. Then I'll go to Councillor Sato.
Yes, thank you. Thank you, Mr. Chair, and thank you, Catherine, for bringing this. I had asked you to do this a couple of weeks ago, and we have set our meetings at the city. I agree with Councillor Demurla that I don't see any reason for moving the August meeting into the middle of August for the 13th. So I was going to ask as well that we change that one to the 6th. We're still on the 2-week schedule. And I just think it aligns more closely with what we are doing in Mississauga. And I think I heard you saying Brampton was their last meeting for the summer was the same. So I fully support if Councillor Demurla is moving the motion as amended to the 6th, I would be pleased to second that.
Thank you, Councillor Sato, and that is the motion before me now. Madam Clerk.
Thank you. Moved by Councillor Demurla, seconded by Councillor Sato, that regular meetings of Regional Council be scheduled for Thursday, July 23rd, 2020, and Thursday, August 6th, 2020, and further that should the provincial declaration of emergency regarding COVID-19 be terminated during the months of July or August, the additional regular meetings be cancelled. Call the vote now. Mayor Brown? Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes? Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden? Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair? Councillor
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente? Councillor Vicente?
Yes.
Councillor Vicente in favor. Thank you. Carries.
That carries. Thank you. Moving on then, the last two items we have for presentation are 8.5 and 8.6, and I think they're related. Andrew Farr can speak to both of them. 8.5, update regarding waste management during COVID-19 emergency declaration, and 8.6, resolution regarding collection of bulky items during COVID-19 emergency declaration. Andrew.
Thank you, Chair. Good afternoon, everyone. For today's waste management update, I don't have any additional service updates outside of what has been communicated previously in our bi-weekly update and at the last council meeting. Today, you're going to see a motion to approve that will allow us to proceed with the recommendations we discussed at the last council meeting. Before I hand it over to Catherine Lockyer to walk you through the process of the motion, I wanted to highlight the key changes. Starting today, we will begin to reinstate a portion of our CRC fees to better manage large loads. We will begin charging for any material over 100 kilograms per day per load. We also continue to receive comments and questions from the public and council about bringing back bulky item service. Beginning June 25th, we will allow bulky items at our CRCs, but they will need to be unloaded by the visitors. We continue to balance our service level with wait times and lineups so that residents leave our CRCs happy. We face the challenge of long wait times extending an hour or more after closing. We are getting everyone through eventually, but adding the dropping off of more goods will only add to the frustration being felt by our CRC users. As we would like to begin the drop off of bulky items immediately, we are confident as much as we would like to start immediately, we're confident that with the extended hours beginning this week and the reinstatement of fees for large loads, these long wait times will subside and will be good to go on the 25th. Any sooner would be a real challenge for our staff and for the patient members of the public visiting our sites. As well, with the move to biweekly yard waste collection on June 29th, our contractors will have the capacity so that we can reinstate the collection of bulky items on that day, or starting that collection period. I'll now hand it over to Catherine to walk us through the approving of the motion you see before you in the agenda.
Thank you. And through you, Mr. Chair. At the March 26, 2020 Special Regional Council meeting, delegated authority was given to the Commissioner of Public Works, Andrew, to use his discretion in connection with waste management services. That was a general delegation of authority. However, on the April 9th, 2020 regular council meeting, that delegation was limited in that bulky items were not to be picked up during the COVID emergency. Because of that limitation, a motion is required, 2/3, to reopen the issue for reconsideration. If the 2/3 motion is carried, then there needs to be a second motion in order to give effect to the terms as Andrew has just outlined. So, Councillor Sato is on the board.
Yes, Councillor Sato, I'll acknowledge you at this time. Please proceed.
Yes, thank you. Thank you, Mr. Chair, and thank you, Andrew. I was disappointed that, and Catherine and I have spoken about this, because I was prepared to move the motion at the previous meeting, and was advised we didn't need it, but I guess staff have since found that we need to go back and rescind. Sorry, my door is closed, but my dogs are hearing somebody at the door. Must be Amazon. Anyway, my main concern, Andrew, is that when we spoke about it 2 weeks ago, the intent was to allow the receipt of the large items at the CRC on the 15th of June. So now it's being pushed in the motion to June 25th, which is basically a few days before. Well, I'm not even sure why we're implementing collection on the 29th when that's the end of the week. The dates just don't really make sense to me. The week of, I'm sorry, I'm trying to find my calendar here. The week of June 25th, that's a Thursday. So to start implementing for the CRCs, I can understand starting it on a Thursday, but it's still a week and a half now later than what we had discussed 2 weeks ago. And then starting on, whoops, no, I'm sorry. My calendar keeps flipping to, sorry, the June 29th is fine because that's a Monday. So I got it right there. It was the June 25th on the Thursday, which is a full week and a half after the date that we had discussed 2 weeks ago at the regional council meeting. So you had advised then, and through our conversation earlier that day, that you needed 1 week to implement the fee. So we approved the fee today. You can implement that next week, which is, what are we on? Oh gosh, I guess that is the 15th, isn't it? Yeah. So we can't implement the collection the same time we implement the fee, so that we're still on the 15th. I'm just very frustrated that we keep delaying this, and you know, if we had dealt with it a couple of weeks ago when it was raised, we would have been already into the fee schedule, and we would be implementing it next Monday to open up the CRCs for collection. So even, I mean, I guess you can't obviously open it on the 15th. Can we open it on the 18th? Get it a week earlier? I just don't want to delay it for another couple of weeks.
Andrew, perhaps you can give some insight on that?
Thanks, Councillor, for your question, and through the chair, and I apologize, I'm trying to do the math on the dates myself as well.
Yeah.
You're correct. So we've timed just to clear it up, we've timed the starting of the collection on the first Monday after we stop weekly
Right, and
garbage
that's
collection.
fine.
Okay, so that works. Okay, so we moved past that. Yeah, and I apologize. Somehow between you and I, our wires got crossed on how I explained the couple of weeks we wanted to wait after putting the fee in place to make sure that the lines did go down so that we could start accommodating bulky items. Our original plan was to put the fees starting this Monday on the 8th and wait 2 weeks and start on the 22nd. Inadvertently, I did the math wrong and said the 15th. What I meant to have was a 2-week period so we can get lines down. It's really crazy these days at the CRCs with the number of people that are attending, and we really don't want to anger people anymore by bringing in more goods. We could push it if you'd like to balance to be a Monday and a Monday to start on the 22nd, so that it's not off in a midweek. So we have the fees could start today on the 11th, and we could start the receipt of bulky items on the 22nd.
I guess my concern is it just doesn't seem to make sense if we're starting CRCs on the 25th, but you can leave it at your curb 3 days later. Well, if that's your garbage collection week, it's for me, for example, it would be 2 weeks later because it's starting on our recycling week, so it's not going to help us until second week of July for part of my ward. But it just seemed to, if it's your collection week on the 29th, you're able to put it at curbside. Why would you bother going on a Thursday, Friday, or Saturday over to the CRC and lugging stuff there? So I just didn't see why we were making them so close together. If they were spread out a week or two, then I could understand that. If we could even bump the to help the people like me who are not going to be into the garbage collection week, the first week of July, to kind of bridge that gap between the recycling and the garbage week. If we could make it the Monday of that week, it would at least give a couple of extra days that people can take it to the CRC if they don't want to leave it for another 2 or 3 weeks.
Okay. I mean, certainly we'd like to have as much time as possible between implementing the fees starting today, or re-implementing, my mistake, starting today to when we actually start collecting bulky items. But if council feels that it would make more sense to have 1 week between the receipt of bulky items and the collection of bulky items on the 29th, we would collectively take the risk that just overwhelms to a certain extent our CRCs. But that's the risk we're going to take. That risk is there on the 25th as well. The longer we wait for extended time to go or extended hours, the more chance we have to get people through those sites.
Yeah, you're trying to scare us by talking about all this risk. I mean, I'm trying to accommodate the residents who have been piling up material in their garages and who those that are dumping it. I mean, the number of mattresses that we've had to send staff out to collect that have not been taken in. I can't believe, I guess everybody's replacing their mattresses right now. But the amount of garbage, large items that are still being left at curbside. And I understand we are charging them a fee for the pickup. So that's a good thing. They're not going to do it again, obviously. But I would like to see, as soon as possible to get at least the CRCs open. And whether it was a misunderstanding or not, my understanding was the 15th, and I was actually sending out the information as we were speaking 2 weeks ago, and had given out the 15th, which would have been 2 weeks at the CRC, and then we start curbside. So I just like to see as long a period of time between the CRC and the curbside collection as possible.
Thank you, Councillor.
And maybe, Mr. Chair, what we could do is make it flexible so that we could give staff direction to aim for the Monday, the 22nd. But if they have to delay to the 25th and give you next week to see how things are going, and then leave it in your prerogative that if you don't see the numbers slowing down, if you think you're going to be absolutely inundated in the 21st or 22nd, then delay it to the 25th and just don't publicize it yet.
Councillor Sato, just to bring it to a head, and I have Councillor Starr on my list as well, for the sake of the 4 days, given that we're deep into this, I like the idea that we leave it to staff's discretion. I think we understand the flavor of what you want to do.
That's what I'm suggesting, Mr. Chair, and I'm asking, I'm amending the wording in my motion, whatever ways the clerk can amend the wording in the motion to give that flexibility to staff for that week.
Very good, so that they can do the best they can. Councillor Starr.
20 minutes ago, I was going to make a suggestion that we just let staff do it with those parameters in place. So that's, I'll be happy to second the motion on that and keep it brief. Thank you.
Thank you, Councillor Starr. Madam Clerk, back to you.
Thank you. So we'll start with the 2/3 vote to reopen for reconsideration, and that the resolution 2020-294 from the April 9th, 2020 Regional Council meeting related to waste management during COVID-19 emergency declaration be reconsidered. I'll call that vote first. Requires 2/3 to carry. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla? Councillor Demerla? Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey? Councillor Downey? Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes? Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden has left the meeting. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yeah.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries by more than 2/3. Brings us to the actual motion. Whereas moved by Councillor Sato, seconded by Councillor Starr, whereas Regional Council at its meeting on April 9th, 2020, approved Resolution 2020-294 regarding waste management services during COVID-19.
Can we move a short reading?
Sure. So the whereas clauses remain the same. I'll just read the resolution. Therefore, be it resolved that the waiving of fees for dropping off waste at the region of Peel CRCs be limited to 100 kilograms per load per day, effective immediately for the duration of the declared emergency or earlier, as recommended by the Commissioner of Public Works. And further, that drop-off of bulky items at CRCs be reinstated effective June 25th, 2020, or earlier, as recommended by the Commissioner of or earlier if the Commissioner of Public Works deems appropriate. And further, that curbside recollection of bulky items be reinstated effective June 29th, 2020. I'll call the vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes. In
favor. Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes? Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden? Right, she's left. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor
Reduce,
Vicente.
reuse, recycle.
Thank you. Councillor Vicente in favor. Thank you very much. Carries.
And Madam Clerk, that satisfies 8.5 and 8.6? Very good. Moving on. I am on to items related to Public Works Communication, item 12.1, Automated School Bus Camera Working Group, letter dated June 2, 2020, providing recommendations on how to best implement appeal school bus stop arm camera program, and also related item 22.2 under notices of motion, motion regarding the Student Transport Appeal Region Procurement Process and the recommendations of the Automated School Bus Camera Working Group for a school bus ride stop arm camera program in the region of Appeal as requested by Mayor Brown. Asked to be held by Councillor Downey. Councillor Downey.
Thank you. Through you, Chair. I just wanted to give a shout out to the Public Works team that has been facilitating the working group and all of the time that they've spent pulling everybody together and all the stakeholders, along with myself, Councillor Raz, Councillor Fonseca, and Councillor Paleshi. The memo is very thorough and outlines kind of where we're at in the region and how we can best support our stakeholders and our school boards. As well, we have a really big opportunity, I think, to lead in Peel on this program. So I thank the mayors for bringing it forward, and I'll leave it to my colleagues. Thank you.
Thank you. Seeing no other, Councillor Raz.
Thank you very much, Mr. Chair. And I just want to thank the Region of Peel team and everybody involved. It truly has been hurting domestic cats. There's a lot of different interests involved here, and to bring everybody around to a linear way of thinking where we can try to move this forward, I think has worked out. So I just want to thank you and everybody for their time put into this. I think making our roads safer and enhancing our school bus, not only stop arm cameras, but looking at the bigger picture of how technology can make things run more efficiently and keep our kids safe with cameras inside the buses as well is the right thing to do. So very happy where we are now, and hopefully everybody can support this. Thank you to Mayors Thompson and Brown for moving them and seconding the motion. Cheers.
Thank you, Mayor Thompson.
Thank you. I'm not going to follow Raz's cat calls here, but what I was going to suggest is the processing center. Peel could be the lead on that, to be the first to the market. And by doing that, gives us an opportunity to generate some revenue into service agreements and MOUs, especially with other municipalities in Ontario. And I know AMO is looking for a lead. And I think this is something that with Peel, with the population we have, would really justify. Could we look at that as well, please? Thank you.
Taken as direction, and thank you. Councillor Sato. Councillor Sato, I can see her on the screen looking to try to get in. Oh, there you are. Go ahead. Go ahead. Go ahead.
No, that's okay. Thank you. I wasn't on the list. My laptop keeps shutting down on me. So
thank you.
I forgot to put my hand down.
Thank you. Councillor Fonseca.
Thank you so much, Mr. Chair. I'll keep it really brief. Councillor Raz, that expression is that you gave is wonderful. I think at the start of the meetings that we had with the collective group, it seemed like, oh no, how are we going to get through all of this? But with persistence and passion and the focus, I think at the end of the day, everybody wants to achieve, as you said, safety of the students and of the drivers and all of the stakeholders and families in the region of Peel. That's where we have come to. So I too just want to say thank you very much to this being brought forward by the mayors, and also to the region of Peel staff and all of the stakeholders in the working group, and also all of the councillors. We had a lot of great discussion, and at the end of the day, the outcome, I think, is well, what you see before you, I think, is going to be the best for a solution for Peel. So thank you.
Thank you. Councillor Paleshi.
Thank you, Mr. Chair. Not much more to add. It was a pleasure working with these three very powerful women, and Councillor Downey, Councillor Fonseca, and Councillor Raz. Their leadership on this file was it was a breath of fresh air to listen to some of the conversation that was happening when we're talking about the safety of our kids, and nobody are bigger advocates than these three, and I think staff from the municipalities and what we have here before us is a tremendous job done by all. So just echoing the words of my fellow councillors. Thank you.
And very well said. Mayor Brown.
Thank you, Chair Yanika. Just to say that thank you everyone for supporting this motion, and to Councillor Downey and Paleshi, who have been doing some of the legwork on this and raising its attention in Brampton. I think this technology can help give peace of mind to parents, and I think this COVID-19 situation pandemic is forcing us to look at technology, how it can better serve our community, and here's an example of where we can do that. So I'm looking forward to seeing this move forward in Peel.
Thank you all. That's my list of speakers. Madam Clerk, over to you. And I don't know if a short reading might be appropriate, but I'll leave that to you.
Thank you. The motion was distributed, so everyone has had an opportunity to review it in your package. So we will do a short reading if that's okay. So we'll just read the resolution action items. Therefore, be it resolved that staff be directed to support the student transportation of Peel Region's stopper procurement process for the suite of modern school bus technologies, with the option to leverage that procurement for the acquisition of stop arm camera hardware and software for a Peel Region stop arm camera program that is compatible with Stopper's selected technology. And further, that the recommendations contained in the working group's letter dated June 2nd, 2020, listed as items 12.1 on the June 11th, 2020 Regional Council agenda, be endorsed. And further, that staff report back to Regional Council with options, scope, and costs for implementing a stop arm camera program which supports Stopper's September 2020 rollout. Call the vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes. Support.
Councillor Dasco in favor. Councillor Dillon.
Support.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes. Councillor Innes in favor. Councillor Kovac. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
No.
Oh, she's missing. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Carries. Thank you.
Thank you, and I think that brings me all the way down to planning and growth items. There were two pieces of correspondence, 18.2 and 3, related to Mayfield, which of course is also related to item 22.1 regarding the notice of motion from Councillor Parrish, Town of Caledon request for ministerial zoning order for Mayfield West Phase 2, Stage 2 lands, just to deal with them all together because they're all interrelated, and I will acknowledge Councillor Parrish first if she wishes to speak to her notice of motion.
Yes, thank you, Mr. Chair. The motion is laid out very clearly. The subject's been gone over several times. I will point out, whereas the authority to determine population allocations in two-tier municipalities has been designated to regional councils, the population allocation for Mayfield West Phase 2, Stage 2 will require 2041 population numbers. Whereas the Region of Peel staff are currently conducting the municipal comprehensive review, expected to be completed by January 2021. And whereas a minister's zoning order is not appealable by citizens, environmental, or other groups and is not subject to local planning appeals, nor a committee of adjustment modification. So we are going to, again from Mississauga, therefore be it resolved that the Council of the Region of Municipality of Peel strongly opposes the request by the Town of Caledon for an MZO for Mayfield West Phase 2, Stage 2. And further, the chair of the Region of Peel forward this motion to the Minister of Municipal Affairs and Housing at his earliest opportunity with a cover letter strongly supporting its intent.
Very good, Councillor Parrish. Thank you. With that, I think I will acknowledge Mayor Thompson, who asked for 8.2 and 8.3 to be held, and then carry on with my list. Mayor Thompson.
Yes, thank you, Chair. You know, I'm not going to try to convince you not to support this motion. I'm not going to ask you to listen to the advice or guidance given by regional staff or professional planners or regional lawyers. I'm not going to state the facts again. And I'm not going to do that because it's just a waste of my time. Maybe I should just ask, what is it about Caledon that you don't like? You know what? I already know the answer. At this council table, rules and policies are applied differently to Caledon. There's a complete lack of respect to our local council decision-making and for our local planning process. In fact, I don't know another lower tier municipality that has been subjected to the level of interference by an upper tier government as what happens here. And people are watching. And I want all of you to know that we full well know that there's a bigger story here. The story has been playing out for years, and every time you vote and overturn a decision of Caledon Council, you're connected to that story. Mr. Chairman, back to you, sir.
Thank you. My list is Fonseca, Innes, Downey, Starr. Councillor Fonseca.
I apologize, Mr. Chair. I am not able to take down my hand right now.
Understood, and thank you. Councillor Innes. Councillor Innes, I see your lips moving, but I can't hear you. Still having some issue with getting Councillor Innes. I see she's trying. Councillor Innes, I'll move along to the next and keep her on my list. My next speaker is Councillor Downey.
Thank you, through you, Chair. Not to belabor the entirety of this issue, but it is my ward. It is a matter of completing a community in my ward. So I think what would be good at this point potentially is to maybe walk through the motion and share with some of my colleagues bits and pieces that are not actually factual. So the second point, the authority to determine population allocations has been designated to regional councils by the province. This is incorrect. As a regional council, we are actually making a recommendation to the minister, since his office is the approval authority, in the case of the official plan amendments in relation to the regional municipality comprehensive review. This is a process to have regard for the recommendation of the local council, the planning advice of both regional and local staff, along with public input, all of which supported the approval of ROPA 34. The second point, population allocation of Mayfield West Phase 2, Stage 2 will require 2041 population numbers that have not yet been reviewed by Peel regional staff nor council. Also incorrect. Regional staff's recommendation report dated March 12, 2020 indicates that both regional staff and council had reviewed the 2041 population numbers required for this ROPA by virtue of the following. Region staff have declared that this complies with the relevant sections of the Act, sections 26 and 17, that apply the official plan amendment. Regional staff acknowledge that ROPA 34 represents an initial settlement boundary expansion to accommodate a portion of growth to 2041. Regional staff also advised that this amendment is consistent with provincial policy, conforms to provincial plans, and represents good planning in the public interest. Third point, early allocation of population to Mayfield West, Stage 2, Phase 2 may reduce population allocations to other part of the region. This is semantic, but incorrect, because it will reduce population available for allocations over other parts of the region. That said, regional council and staff have acknowledged this by requesting and receiving confirmation from the Minister of MAH on October 2019 that stage ROPAs to implement the regional MCR process are permitted for situations such as this, where completing communities are not delayed by a lengthy MCR process. This was also illustrated in 9th line. As we carry on, Councillor Parrish has stated in her motion, and whereas the Regional Peel planning staff are currently conducting the municipal comprehensive review to be completed January 2021. The only portion for ROPA 34 that is incomplete is the approval at this council. So even after being told that it was illogical not to move it forward, this council did that. So that's really the only stage that's keeping us from getting there. And a misleading statement that in January 2021 is the earliest date the regional staff expect to complete their settlement area boundary expansion study and seek direction from regional council to start the statutory public process. For this one component of the MCR potentially leading to an urban boundary expansion or ROPA no sooner than April 2021, likely later. The entire MCR review associated with ROPAs to implement the same was scheduled for summer 2022, pre-COVID timing. Another portion of the motion that is incorrect, whereas an MZO by its nature circumvents the normal planning process and overrides the province's own policy. An MZO could circumvent the normal planning process, but in this case, all tests have been met with the exception of the regional council resolution. Also, it is not clear what provincial policies are being overridden by the provincial policy statements to allow for exactly this, remembering that this is part of an MCR. I will note again that this council is not the approval authority for this, the minister is, and the only step that is keeping this community from being completed is approval by this council. I think it's important that we look at this closely and recognize that it is identical, as I've said before, to 9th line, and that our unwillingness to allow this to move forward is constraining all of our processes, it's constraining our staff, and ultimately the community. Thank you.
Thank you, Councillor Innes. I reach out to you again. And I still seem to have the same difficulty. I see Councillor Innes on my screen trying to speak, but none of us, I believe, can hear the words. Again, I will come back to Councillor Innes later, carrying on with my list. Councillor Starr.
Thank you. I think a lot of us had a long time to review all of the, requests coming through. I think one of the most telling paragraphs that I've seen recently is from Patrick Harrington in the second page, and I'll just read it to you. The reason why Council has fundamentally altered course in Mayfield West Phase 2, Stage 2, were not made clear when the deferral of ROPA 34 was directed to staff's in-depth analysis and recommendation report was effectively ignored. The reasons for continuing the deferral are still not clear in the subject motion to oppose Caledon's MZO request. I, for one, am unclear going back in my thinking, in my notes, which I've dug up, and I'd like to have somebody answer that. And I don't care who.
I don't know if Adrian would like to give it some context. Adrian, if I can phrase it for you again, Councillor Starr has pointed to a paragraph in the Aaron Burgess letter on the agenda that reads, reasons why Council has fundamentally altered course on Mayfield West 2, Stage 2 were not made clear when the deferral of ROPA 34 was directed. Staff's in-depth analysis and recommendation report was effectively ignored. The reasons for continuing the deferral are still not clear in the subject motion to oppose Caledon's MZO request, as alleged by Patrick Harrington in his letter. That's what Councillor Starr has asked for an interpretation. Adrian, I would turn to you first for that if you could.
Sure. Thank you, Mr. Chairman. Hopefully you can hear me.
Yes, we can. Proceed.
Okay. Thank you for the question. So, in terms of context, I think it's you know, the timing is such that yes, staff had recommended and brought forward that recommendation in March for a phased implementation of the municipal comprehensive review to expand the settlement boundary to accommodate Mayfield West Phase 2, Stage 2, and the decision of council at that time was not to make a decision as recommended by council, but rather defer it to have it come back in the context of the broader municipal comprehensive review. And I think what council was essentially directing us to do as staff in that context was to bring back the matter around decision making around settlement expansion for Mayfield West Phase 2, Stage 2, in the context of the broader work that we're doing to consider all of the settlement boundary expansion that would be required to accommodate growth to 2041. That's my understanding.
Councillor Starr, if you had anything further, you can come back on the list. I will leave it at that. Next on my list, Mayor Brown.
Thank you, Chair Nika. I just wanted to say, certainly tired of these ongoing conversations, and so I'm not going to repeat myself because we had this discussion in a protracted manner. But I would say, I don't know why we continue to involve ourselves in the development issues in Caledon. I certainly would be offended if regional council was doing the same thing in Brampton. I think we should be respectful of their council's decision. And Mayor Thompson, I think, makes some very valid points. I think this is continuing to raise attention why there's so much interest in this issue. I don't, if anything, I think it sends a message to the province, a very negative message that we're trying to interfere. I think we got bigger asks of the province when it comes to, we just talked about our fair share campaign. There's going to be more significant asks we have of the province, not enabling us to interfere in a municipality's sovereign decisions. And so I don't support this motion, and I certainly appreciate Mayor Thompson's frustrations.
Thank you. Councillor Innes. Geez, we just can't win. Okay, we'll keep trying, Jennifer, with apologies. Carrying on, Councillor Groves.
Thank you, Mr. Chair. I will be supporting the motion. I think that regional council does play a role in these decision making, and I'm going to tell you, The reason why regional council gets involved in Caledon decision making is because Caledon plans by individuals, not by good planning. Right now, Mayfield West, phase 2, they do have a population sitting there of 10,300 people, of which they haven't done anything with. I agree with Adrian that through the MCR, we need to have a broader look at the municipal comprehensive review process. I'm not quite sure what the hurry is in moving forward to stage 2 when the MCR isn't finished and when nothing's been done with the 10,300 people that they have. That's about, I'm going to guess, about 3,000 to 3,500 homes. And I just want some clarification from Adrian, because they keep comparing 9th line to Mayfield West phase 2. So if Adrian can clarify if it's the same thing as 9th line, because my understanding from last time and the last meeting we had on this, it was not the same. And also, Adrian, if you can clarify for us where the population will be coming from for Mayfield West phase 2, stage 2.
Adrian?
Thank you, Mr. Chairman, and thank you for the question. In fact, there are lots of similarities between Mayfield West Phase 2, Stage 2, and 9th Line. Both require amendments to the regional official plan to expand the urban boundary to accommodate growth in those areas, and both required that needs to be done as part of a municipal comprehensive review. So there's lots of similarities in that from that perspective. There are a few differences. The 9th Line lands has status in terms of a development potential because of its history, originally under the Halton Regional Official Plan and the annexation that happened to bring it into the region's geography. So that's certainly a different situation in terms of them moving forward. And so there's that. In terms of where the population is coming from for both, the 9th Line lands, although they did require municipal comprehensive review, the population is coming from that's already been allocated to Mississauga as part of our official plan. The population that would be required for Mayfield West Phase 2, Stage 2, would come from the additional growth that's been allocated to Peel in the Schedule 3 of the growth plan, and that's happening through our municipal comprehensive review. You might recall that when the province allocated that additional growth to Peel, they did it in sort of two buckets. They added some additional population to the 2031 number for Peel, and we talk about that as often referred to as the 2031B numbers, and then an overall 2041. All of that, both buckets are being dealt with through our municipal comprehensive review. It so happens that for Mayfield West Phase 2, Stage 2, it fits within that first bucket of the 2031B numbers.
Thank you. That brings me... Sorry, go ahead. If there's a follow-up, Councillor Groves, go ahead.
Yeah. I recall at the last meeting, and Councillor Parrish asked you, because you sort of danced around it, and you're dancing around it again. So I just want to be clear that the population for Mayfield West Phase 2, Stage 2 is coming out of the 2041 numbers. The MCR process that we're reviewing is about the 2041 population numbers. Is that correct?
Through you, Mr. Chairman. So I apologize if I sound like I'm dancing around it. It's only because it is complicated and are these different buckets. But you are correct that the population for Mayfield West Phase 2, Stage 2 is being dealt with as part of the additional population through the 2041 MCR. Yes.
Thank you. And the population from 9th Line came out of 2031 or 2021?
2031.
2031. Thank you. So they are not the same. I didn't support the MZO at Caledon Council, and neither did my my colleague, Councillor Rosa, because first of all, we had no idea that an MZO motion was coming forward to Caledon Council. We were completely blindsided by that. There was nothing on the agenda, and it was just a complete we were just completely blindsided. I know that my community in Bolton, and Councillor Rosa feels the same, they do not support this MZO. The MZO does bypass public process. And the important thing to note is that this MZO, it's not appealable. So it excludes the public and engagement of the public and their comments and their concerns, because once you get an MZO, you cannot appeal that. For me, that is undemocratic. And I certainly think that we have democracy here. You know, it's interesting because I read in one of the letters, I think it was Mr. Given's letter, where they're talking about having housing and moving this development forward so you can collect development charges in that. Well, you know, these are the same guys that are appealing Bolton. And out of Bolton, there's $170 million in development charges that is just held up because of these same folks who are in Mayfield West Phase 2, Stage 2. So I have a real problem supporting an MZO because an MZO was issued on Canadian Tire in Bolton. The public was not happy about it because they had no say. And here we go again. There is enough population applied to Mayfield West Phase 2, Stage 1, 10,300 people, that they can move ahead and start building. There are a number of servicing issues that are pending that hasn't even been addressed for Mayfield West Phase 2, Stage 1. So we're just sort of putting the cart before the horse here. And Mayor Thompson said that Peel is interfering with Caledon. Well, Caledon also has no regard for the decision of Peel Region. Considering that Peel Region, they do pay the dollars to for infrastructure. I think that we just need to be patient. And these developers, I'm not sure what the rush is, but so I will be supporting the motion because I certainly don't support an MZO. The Premier said he's for the people. Well, I don't know, because those decisions that I'm seeing coming out of Queen's Park lately, he's not for the people. It's all the developers. I mean, MZOs are being issued like candies. So let's just not have a council then. We should just not even have a council and just allow the province, get rid of our planning department and let the province plan it, because that's exactly what's happening. So why have a planning department when the developers are just going to bypass process, complete disregard for the public, and go straight to the minister to ask for an MZO? Get rid of the planning department and get rid of council.
Thank you. Councillor Innes, one more time. Oh, and the staff here is working furtively, and we thought we had you. I will come back again with sincere apologies. Councillor Sado.
Thank you, Mr. Chairman. And, you know, I didn't think we were going back to discuss the whole issue of whether or not we should be doing, making decisions that we made back in March and previously to that. My understanding is that the motion is just reaffirming and reminding everyone and reminding the province that this council has already taken a position on this, not just once, but twice, and advising the province that the request by Caledon circumvents a decision by regional council. And Mayor Thompson, you know, with all due respect, I could probably sit down with Mississauga staff and bring a very, very long list of times when regional council decisions have circumvented decisions that have been made by the city of Mississauga in many, many areas over the years. So I won't do that, but I certainly could, and I think the list would be a heck of a lot longer than any for Caledon. You know, we've made the decision twice, and I get really tired of hearing developers and other members of council touting on about how we did ninth line. I think I probably have, well, I definitely have more experience and more knowledge of the ninth line situation than anyone else on this council, including the planning staff, because I've lived through every single day of the ninth line planning, and it is not the same at all. The ninth line work that was done by the Region of Peel was a housekeeping matter. I went through the entire process when we bought the ninth line lands, when Halton brought forward their official plan. I was the councillor for that entire area, for the purchase of the lands, for the Halton official plan, for the time when the province said that we as Mississauga and Peel had to adopt the official plan and the population numbers that the province had approved for the lands all along ninth line. So as far as the Region of Peel was concerned, we had no recourse. We had to adopt those numbers. We had to adopt the official plan. We wanted to make some amendments to the official plan in some of the land use areas. That resolution should have come forward to council 5 or 6 years ago to undertake the housekeeping amendment. Staff asked us to hold off, not to bring it in with, I think it was the bill 20, our amendment 24, OPA 24, but we really should have pushed ahead and brought it in on that. Staff didn't want to open up to appeals and everything else. But ninth line has always been a housekeeping issue. Not the same at all. It's not an add-on. It's not new. Never was. It was not our decision. It was the province of Ontario's decision. We had to adopt it. So let's get off this. It's the same as ninth line bit, because it's definitely not. When it comes down to,
you hear me talking? The lights are going up and down.
When it comes to municipalities making decisions that are different, that are different from the Region of Peel, you know, I can understand Caledon's position, where if they feel that they want to make a different decision, then you know, they have that right to make it. But I think we as a regional council also have a responsibility to uphold decisions that we have previously made on these issues and to stand behind those motions. So, you know, we've done it twice as a motion. And I think today we are just reiterating the fact that that's the position of the Region of Peel. You know, as I said at the beginning, if you want us to bring forward decisions that have been made by the Region of Peel that have really messed up the city of Mississauga, we can bring you a very long list, some within the past 24 months, actually, or 12 months even. So, you know, let's not get into that. But I'm hoping today that council will just approve this motion. You know, don't open up another kettle of worms. Like Caledon, you can make your request, but I think the Region of Peel as council, we have to stick with what we've already approved.
Thank you. Jennifer, I had you a moment ago. Please try again.
I'm going to try. Can you hear me now?
There you go. Go ahead.
Thank you. And my apologies to Councillor Sato if it was going over top of you. I don't know. It's welcome to Caledon's internet. So I'm going to be brief, given that the comments that have happened. I know that Councillor Downey already went through the list of the motion and the things that were factually incorrect. So I'm not going to waste your time or my time. I'm sure a bunch of you are expecting me to bring some amendments forward, but there is no point because we know how that vote will end. At a recent council meeting, I believe that it was Councillor Parrish who said we shouldn't be picking one developer over another. And there wasn't one person around this table that would disagree with her. That's not good community planning. However, every single time we sit around this table and vote on a planning application for a planning matter in the town of Caledon, there are a group of aligned voters who votes in actuality only ever help one lone wolf developer. The result is that this voting bloc has prevented the town of Caledon and the Region of Peel to move forward on development applications. It has rejected sound planning justifications from the town of Caledon and the Region of Peel. But what perturbs me the most
is that this voting bloc continuously rejects the voices of our community's residents and businesses who have participated in a full, public, open, and transparent process that helped council determine these planning decisions that they brought forward to the region of Peel. These are the people who will have to live with this council's decision, and they're also the people who have to pay for it and continue to pay for it. I will not be voting to help one lone wolf developer over the best interest and the will of my community. I will not support this motion today.
Thank you, Councillor Downey.
Thank you, through you, Chair. I guess I just, I'm not sure if you have more speakers on the list. I think it's really important listening to all these comments to remind everyone that my request for an MZO to the province is in no way, shape, or form circumventing any type of planning or anything. All of those tests have already been met. The public meeting was held. The report was put forward. Our staff were in full support of the ROPA, local and regional staff. Our legal, you heard from all of them, all in full support. The only non-support is the voting bloc at the regional table. And just to remind you, the region is actually not the approval authority for that ROPA, the province is. So I made the request to the province. I did that with the majority of my local council. And I guess we'll just wait and see what the province has to say about it.
Thank you. Councillor Parrish.
Yes, thank you, Chair. Adrian, the MZO that was granted recently to Brampton, is that coming out of 2041 POP numbers as well?
Through you, Mr. Chairman, that MZO was around an employment conversion matter, so it didn't sort of tie in directly to the population employment numbers that we're talking about here.
Well, that was not a good answer. I still don't understand. It's gone from 100% commercial employment to about 85% residential. Are those residential numbers coming out of 2041?
So through you, Mr. Chairman, because that's a relatively small number and we have allocated population already along the Queen Street corridor in terms of intensification, what have you, it would just be incorporated into those numbers. It's not at the scale of a settlement expansion that would require all that land budget and all that.
That's not what I asked you. The population that will be going into that MZO that was recently granted will be part of 2041 residential population numbers, correct?
It'll be part of the overall allocation to Brampton, yes.
Thank you. Now, as far as the Brampton Mayor's comment is concerned, we are not sovereign municipalities. We would love to have been a sovereign municipality, but it doesn't quite work out that way. Since we were not granted that privilege, we are part of a team. We are trying to build the team so it works together. One of the functions of the team is to do the allocation of population numbers. Brampton has consistently said they're unhappy with the fact they have too much residential, not enough commercial industrial to carry their taxes the way we do. And Mississauga staff is now taking it very seriously. Every time we have any issue coming up at the region, they're looking at it very carefully because we're spending almost 60% of the money that goes into all these projects. So as I say, we would have been very happy to be a sovereign municipality. In fact, we thought we were well on our way until a few shenanigans up at the region. So our staff has recommended that we wait for the municipal comprehensive review, which will now include the Brampton MZO. And if you read the Globe and Mail and you read last Saturday's Toronto Star, MZOs are high-handed. They go around the planning process, as exampled by Councillor Downey's comment that she's going to the province to get this, because the province makes the ultimate decisions. But the province has it set up so that we, as a regional council, make these decisions, make these recommendations, and they finally approve or don't approve. So this council voted 16-5 last time. And I resent the comment that it's helping a particular developer. I don't think he's even involved there, if that's the one you're referring to. I don't vote that way. I vote according to, number one, what my common sense tells me. Number two, what our staff tells us. We have a very strong, powerful staff at the region or at the city of Mississauga. They go through all these things with a fine tooth comb now. Never used to, because we thought we were leaving. We didn't, we were told we can't leave. So while Caledon, Mayor Thompson, is putting in 5% of every cent we spend up there, we're putting in close to 60%. So we are looking at everything carefully. We're also looking at it practically. We are also looking at what it's costing our taxpayers. So I resent half the comments that were made today, but I'm not even going to dignify them going into. This is a simple request to the province to say you're getting an MZO request. It's lobbyists, it's political, it's not planning. And we're saying to you, the decision was made here repeatedly, and we want you to honor that decision. And as you said, Councillor Downey, it'll be up to the province to decide if they want to listen to lobbyists and elements from Caledon, or if they're going to listen to the Region of Peel decision that's now will be confirmed a third time. Thank you.
Thank you. My list is Starr, Paleshi, Brown, Crombie, Groves, Downey, Innes. Councillor Starr.
Having a problem with this, I'll put me on the list later.
No, Ron, you're good to go. I can hear you if you'd like to proceed. Very well, then I'll come back. Councillor Paleshi.
Thank you, Mr. Chair. So I like Councillor Mayor Thompson, won't get into too much of the details, although just some of the things that have been said, it's funny to listen and kind of think back and say, no, that didn't happen. No, that's not right. I'm pretty sure that Mayfield West went through the public planning portion because I was there representing planning chair at the Region of Peel and also the area that I represent. And then when we talk about MZOs coming out of Brampton, well, it was a council decision that was appealed by a landowners group, which then was taking a long time. So Brampton made the decision to request the MZO. And Councillor Sato, I'd like to see that list. I don't want to put too much work on you, but I don't recall a time when Brampton and Caledon voted against Mississauga with something coming out of Mississauga, other than maybe just once. So with respect, I would like to see the list. I don't recall Mississauga councillors coming over onto a different side and going against what your municipality had wanted, and then the region squashing that. I'm speaking to my Brampton colleagues, and I've said it before, and I'll try and summarize what I've said before. I need this to continue so that the community that I represent is completed, so that buses can get up to the seniors' home that needs the busing to get up there, so that we stop sending our works crew out to clean up garbage at the end of incomplete communities. Brampton needs this, and I wonder, and I ask myself, one day when the city of Brampton is looking to do much the same, are we going to be stopped by a municipality? Because yes, Councillor Parrish, we're a team, but I start to think that you want to make this as dysfunctional as possible to show the province that maybe they didn't make the right decision. And maybe that's the true motivation, Councillor Parrish. Maybe, right? Thank you, Mr. Chair.
Thank you, Mayor Crombie.
I'm a little surprised at the personal innuendos, allegations occurring. I'll tell you how I vote. I vote with the best interests of my taxpayers and my residents in mind, because we do here in the city of Mississauga pay 60% of the bills. And that's how that works. I consider what is good planning and what is in the interests of my taxpayers. And like it or not, these kinds of decisions are left with the region of Peel. Unfortunately, you know that we wanted something different, but the minister wouldn't give it to us. So we're all in this together. And unfortunately, we still have input into the decisions that are made in Caledon, and we're going to continue to make them in the best interests of Mississauga taxpayers. And Mayor Thompson, to you, you have councillors from your own municipality that are voting against this. So this is not an us or them or voting blocks, as Councillor Innes has said. That's just silly. There's no voting block here. We all do what we think is right. And for myself and my councillors, we do what's in the best interest of Mississauga. Now, we've twice voted on this, twice. And the Caledon going to the minister to ask for a special exemption because they didn't like the vote at the region is really unacceptable. That's not how you do business. And the minister now intervening when he knows that we have twice voted on this is just plain disrespectful and superseding our authority as a council. And I've told him so. That's not how you do business. That's not how any government should do business. He kept us as a region for his own reasons. And now he's going to come in and interfere and override our decisions we've made twice. With this decision, we need an MCR because we're talking about 2041 numbers. Now, with respect to the two letters that came in this morning, I haven't read them. They came in today. That's no way to do business either. This motion was on the table a week ago when I got my binder. You can't send me updates at 10 a.m. when I've already got all of you on my screen. I'm not checking my email and reading letters that should have been attached much before this morning. That's unacceptable. I'm not going to vote. I'm not even going to consider what's in those letters because they should have been in my package a week ago at least. So I don't know why we're having this debate again. I don't know why Mayor Thompson would make the kinds of innuendos and allegations impugning our integrity the way he has, or Councillor Innes. This just isn't right. We're here together to make decisions, and we've done so. Now we move on. You can't go to the minister and ask for special exemptions when you don't like the result. That's not how this works. It's disrespectful of the process, and he can't intervene. His intervention is non-appealable. We're waiting till the end of the year. It's not a long time to wait. You'll probably get the result you want once the municipal review's been done. So I don't really understand why Caledon would be so audacious as to go directly to the minister to supersede a decision we've taken of this council. That is very disrespectful to the region. I'll leave it there.
Thank you. Councillor Groves.
Thank you, Mr. Chair. I think Mayor Crombie said it quite well. I am disappointed that Caledon Council has decided and to personalize this. This is not a personal issue. This is about good, sound planning. And I'm going to reiterate again, Mayfield West Phase 2, Stage 1 has a population of 10,300 people that's been allocated to them by the region of Peel, and nothing's been done yet. There's not a shovel in the ground, and an MCR process is happening. I think they need to respect the process. And really, if we want to talk about voting block, well, just have a look at the votes at the town of Caledon, and you'll see what voting block really is. Thank you.
Councillor Starr.
I've heard enough. Thank you very much.
And my last speaker, Councillor Downey.
Thank you, through you, Chair. As I've said before, and I'm not sure I appreciate the calls of disrespect. An MZO is a planning tool. It is a planning tool that is available to all of us. The ministry makes the final approval on the ROPAs. And you know, also around this table, what's been interesting is that people keep referring to good planning, but the planning report for that ROPA put before you was from our staff. Regional staff support the ROPA. Local staff support the ROPA. So if you don't believe that it was good planning, you are calling out their professional integrity and the reports that they put in front of you. So that's my first issue. Second issue, an MZO is not like, this is available to us. Caledon has chosen to use it to let the province know this is where we're going, this is what we need to do. It will create jobs, it will create places to live, and it will complete our communities. It will complete the links between Councillor Fleshy's ward and my ward, and the efficiencies on building that infrastructure are infinite. So what we can't understand about that, I'm not sure. But ultimately, as I said before, the decision will be that of the ministry, and we'll wait to hear from them.
Thank you. That exhausts my list. The vote over to you, Madam Clerk.
Thank you. Given the discussion, I believe that a short reading is in order, so that the motion moved by Councillor Parrish, seconded by Councillor Medeiros. Therefore, be it resolved that the Council of the Regional Municipality of Peel strongly opposes the request by the Town of Caledon for an MZO for Mayfield West, Phase 2, Stage 2. And further, that the Chair of the Region of Peel forward this motion to the Minister of Municipal Affairs and Housing at the earliest opportunity with a cover letter strongly supporting its intent. We'll call the vote. Mayor Brown. Mayor Brown. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes, I support it.
Mayor Crombie in favor. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
No.
Councillor Downey opposed. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
No.
Councillor Innes opposed. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor Medeiros. Councillor Medeiros in favor. Councillor Paleshi.
No.
Councillor Paleshi opposed. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos. Councillor Santos. Councillor Sinclair.
No.
Councillor Sinclair opposed. Councillor Starr. Councillor Starr.
No.
Councillor Starr opposed. Mayor Thompson. Mayor Thompson.
Catherine, it's Councillor Dillon. Can you hear me?
Yes. Councillor Dillon.
Yeah, I voted no, so I'm having technical difficulties.
Thank you, Councillor Dillon. Councillor Dillon opposed. Mayor Thompson. Councillor Vicente.
Yes.
Councillor Vicente in favor. I'm just going to recall for those that didn't respond. Mayor Brown. Okay. And Councillor Santos.
She voted yes.
Okay, Councillor Santos is in favor. Mayor Thompson. Okay.
Catherine, I have Patrick on the line.
Okay. He voted opposed. Okay, Mayor Brown opposed. Motion carries.
The motion carries. Thank you. Madam Clerk, I think that brings me down to the bylaws that I will turn. Oh, sorry. Everything else is concluded except for other business and councillors' inquiries. So I go to other business or councillor inquiries at this time. Seeing none, one quick shout out. I don't think you may all have seen it. Hope some of you didn't miss it though. Great announcement this week that $150 million going to the small rural communities so that they can have much more connectivity and broadband. And the one person to thank more than anybody for that sits in this chamber, not today, is Mayor Thompson. What a huge success in his efforts that go back decades to help the small communities in terms of the modern era and connectivity. And Alan, well done with $150 million announcements to help in that cause. And you were at the vanguard all these years, so well done to you, and Caledon and others should be very, very grateful. Okay, Madam Clerk, that now brings me down to you. If there's no other business or councillor inquiries, we dealt with the notices of motion. Bylaws, over to you.
Thank you. Moved by Mayor Brown and seconded by Councillor Carlson that the bylaws listed on the June 11th, 2020 Regional Council agenda, being Bylaw 45-2020, be given the required number of readings, taking as read, signed by the Regional Chair and the Regional Clerk, and the corporate seal be affixed thereto. Are there any objections? Seeing none. Carried. We have a resolution moved by Mayor Crombie, seconded by Councillor Demurla, that Bylaw 46-2020 to confirm the proceedings of Regional Council at its meeting held on June 11th, 2020, and to authorize the execution of documents in accordance with the Region of Peel bylaws relating thereto, be given the required number of readings, taking as read, signed by the Regional Chair and the Regional Clerk, and the corporate seal be affixed thereto. Are there any objections?
And with that, as chair, I will ask for a motion to adjourn that I've gotten from Councillor Fortini and Councillor Palesci. Anyone opposed? Thank you. We stand adjourned. Thanks to all and to staff.